Yeah, hello guys, good evening, namaskar. It's Dr. Dinesh here, and we are live for this recall. So, जितना desperately बेटा आप लोग वेट कर रहे थे उतना desperately हम लोग भी वेट कर रहे थे कि the exam will be over and then we will definitely come live to discuss this question paper. So first of all, जितना feedback हमें मिला from the students, from the all the stakeholders. So the paper was not easy as usual. Since last 3-4 times you can see continuously they are giving the moderate to tough paper, right? So easy paper nahi tha. It was overall, first paper was tougher side, second paper was moderate. So I would say it is moderate to tough, right? Not easy to moderate, moderate to tough, right? So beta, first of all I would say 2-3 important things for all your juniors who are giving this upcoming exam. I know you all will pass, no need to worry, because whenever there is tough paper we have seen the result was good. Most probably the reason is कि आप लोगों को अंदर टफ लगता है पेपर, बट आप लोग सही अटेम्प्ट कर पाते हैं एंड यू गिव द करेक्ट आंसर. इसलिए देर इज नो नीड टू वरी, बिकॉज इन आवर एक्सपीरियंस वी हैव सीन कि जितना भी बार आप लोगों ने आके बोला कि पेपर टफर साइड में था उतना ही रिजल्ट अच्छा है. तो ऐसा तो नहीं हो सकता कि अपनी मर्जी से आ रहा है रिजल्ट. इट मीन्स देयर हैज टू बी समथिंग, तो इसका मतलब क्या हुआ कि आप लोग उस टफ पेपर को अच्छे से अटेम्प्ट कर पाते हैं एंड दैट्स वाई द रिजल्ट इज गुड. तो आप लोगों का रिजल्ट अच्छा आएगा, उसमें मुझे कोई डाउट नहीं है. बट फॉर जो आने वाली जनरेशन जो अगला एग्जाम देगी उनके लिए आई वुड से कि बेटा मेरा सजेशन जो मैं हर साल देता हूँ कि पेपर इज नॉट गोइंग टू बी इजी नाउ. इजी नहीं रहने वाला है, टफ ही रहने वाला है. तो अच्छे से प्रिपेयर करो, अच्छे सोर्स से प्रिपेयर करो. आप अच्छे से प्रिपरेशन करोगे, कॉन्सेप्ट क्लियर करोगे, ज़्यादा अच्छे से पढ़ाई करोगे तो किसी भी टाइप का पेपर आ जाए कोई फ़र्क नहीं पड़ेगा. बट ये जो वन लाइनर्स और ये जो खाली PYQs के भरोसे या फिर जो है एक ही आदमी 20-20 सब्जेक्ट पढ़ा दे, तो वो फिर ना आपके कॉन्सेप्ट क्लियर नहीं हो पाएंगे. इसलिए कोशिश करो कि सब्जेक्ट एक्सपर्ट से पढ़ो, अच्छे से पढ़ो और जो है कॉन्सेप्ट लर्निंग करो, क्लिनिकली कोरिलेट करो, रेगुलर क्लासेस अटेंड करो, तब जाके आपको अच्छे से समझ में आएगा. ठीक है, ओके. तो डेफिनेटली बेटा, ठीक है. तो लेट्स स्टार्ट विद द सम क्वेश्चंस. And definitely this is just a recall, so I will just share some MCQs and you have to give me the exact option so that we can recall ki what was the correct answer. ठीक है, but definitely tomorrow we'll update with the proper recall, but abhi we are going to discuss the some important question. ठीक है, so let's start. Let me check the questions I have written. So beta, question number 1, there was one question from the narcolepsy. There was one question from the narcolepsy. Was it there? There was one question from the narcolepsy. Was it there? Because this is just a recall, so you can tell me exactly. तो बताओ, was any question related to narcolepsy? If narcolepsy related question, whether it was clinical question or was it direct question, they asked about the drug used for narcolepsy, then definitely go with the modafinil. बहुत सारे बच्चों ने बताया modafinil was there in the choice, तो modafinil will be the correct answer. If you have attended the class, I hope you know कि modafinil is the drug of choice for narcolepsy. आप मुझे करेक्ट कर सकते हैं कोई भी डाउट हो, right? Because again I would say this is just recall. We don't know the exact question, we don't know the exact language, we don't know the options as well. You can guide us in better way because you have given the exam, so you can tell us, right? So next question. Question number 2. Next question, question number 2. In question number 2, sumatriptan. sumatriptan mechanism of action was asked. sumatriptan mechanism of action was asked. तो बताओ बच्चों, sumatriptan mechanism, was it asked? Sumatriptan mechanism of action. So if sumatriptan mechanism of action was asked, everybody knows the mechanism of sumatriptan is 5-HT 1B 1D agonist. 5-HT 1B 1D agonist. So बेटा, if any doubt you can correct me. बिल्कुल ठीक बात है. sumatriptan mechanism was asked. Proper question पूरा recall करके will upload later on, but right now we are just discussing the the questions which have been asked. You can correct us with the options, you can correct us the language कि क्या पूछा था एग्जैक्ट. डेफिनेटली क्वेश्चन क्लिनिकल हो सकता है, क्वेश्चन वीडियो बेस्ड जो बता रहे हैं, कुछ 2-4 क्वेश्चन वीडियो बेस्ड भी आए थे, तो जो भी था, लेकिन sumatriptan था. दैट्स व्हाई आई ऑलवेज से कि बेटा इफ यू सी द लैंग्वेज, इफ यू विल सी द लैंग्वेज ऑफ द क्वेश्चन ना, तो फिर आपको समझ में आ जाएगा कि आंसर क्या है, क्योंकि कुछ ना कुछ हिंट तो आपको मिलेगा. तो दैट्स व्हाई ऑलवेज चेक द क्वेश्चन एंड सी द कीवर्ड्स, सी द अपनी लैंग्वेज में उसको देखो कि क्या आपको लग रहा है आंसर क्या हो सकता है. तो दैट वी हैव ऑलरेडी डिस्कस्ड. नाउ द क्वेश्चन नंबर 3. क्वेश्चन नंबर 3 अबाउट द लेप्रोसी. अबाउट द लेप्रोसी ट्रीटमेंट दे हैव गिवन कि पेशेंट इज ऑन एंटी-लेप्रोटिक ड्रग. Patient is on anti-leprotic drug, then having some reactions. So obviously which type of reactions? Lepra reactions. Now maybe it is lepra 1 or 2, you will tell me कि कौन सी reaction दिया हुआ था. तो lepra reactions were there. Now what is the next step of management? क्या करना चाहेंगे? If this was the question, the answer will be continue the. This is, I would say, it is one of the PYQ of NEET PG. ऐसे कैसे NEET PG में आया हुआ है. तो continue the anti-leprotic drug, continue the anti-leprotic drug plus give the steroid, plus give the steroid. ये ऑप्शन पक्का होगा कि सर क्या करना है. तो continue with the anti-leprotic drug and give the steroid. हो सकता है सिंपल दिया हो, एंटीलेप्रोटिक रोक दो, खाली स्टीरॉयड दे दो. मे बी दे हैव गिवन कि सर थैलिडोमाइड दो, बट नो, दिस इज द करेक्ट आंसर. कंटिन्यू एंटीलेप्रोटिक ड्रग एंड स्टार्ट द स्टीरॉयड, बिकॉज स्टीरॉयड इज द ट्रीटमेंट बट यू कैन नॉट स्टॉप द एंटीलेप्रोटिक ड्रग. राइट. सो यस, तो चलिए ये हो गया आपका रिलेटेड टू लेप्रोसी ट्रीटमेंट. देन एज यूजुअल हम बोलते हैं कि बेटा देखिए, अब सेम वही चीज़ आप अगर क्लास अटेंड करेंगे तो आप पाएंगे कि टीबी, लेप्रोसी, HIV पूछा ही जाएगा, माइग्रेन पूछा ही जाएगा, तो पूछ लिया उन्होंने. राइट. लेटेस्ट ट्रेंड में नार्कोलेप्सी, तो पूछा ही जाएगा. नाउ कम्स टू द क्वेश्चन नंबर 4. टॉपिक्स आर सेम, टॉपिक नहीं बदलेंगे, क्वेश्चन की लैंग्वेज बदल सकती है, टॉपिक नहीं बदलेंगे. तो क्वेश्चन नंबर 4, इसलिए उन टॉपिक्स को अच्छे से पढ़ो. इन क्वेश्चन नंबर 4, या डेफिनेटली इन क्वेश्चन नंबर 4 there was question, video based question in which extrapyramidal symptoms were given. Extrapyramidal symptoms seen after starting any drug. Last time they given the rabbit, image of the rabbit. Obviously leprosy treatment will be same, right? Definitely. So EPS seen after starting a drug and video was given. So extrapyramidal symptoms, and they asked which drug is this. So let me tell you कि बेटा वीडियो देखा, आपको समझ में आ गया. दिस इज extrapyramidal symptom after giving the drug, having tremors, dystonia. So which drug is this? So obviously find out the option antipsychotic drug. Antipsychotic drug. In option as per student haloperidol was given. haloperidol was given, so you can correct me if any wrong option, any other option. Yes बेटा, that's why I'm saying रितिका कि अभी तो ना आप हैंगओवर में हो एग्जाम के, तो बहुत सारे क्वेश्चन ना आप मिक्स कर रहे होंगे कि 2 क्वेश्चन एक टॉपिक से आगे 3 आगे और आपने उनको मिक्स कर दिया, तो आप देखोगे कि बाद में ना आप पाओगे कि आपके दोनों ठीक हैं, आपके तीनों ठीक हैं। इसलिए मैंने बोला कि जितना मर्जी टफ पेपर हो बेटा, मैं आपको लिख के दे रहा हूँ, रिजल्ट अच्छा आएगा। दूसरी चीज़ देखो, रिजल्ट ना बस उनका नहीं आ रहा है जो है पास ही नहीं होना चाहते, बाकी आप सब लोग कोशिश कर रहे हो तो अच्छा रिजल्ट आएगा। हाँ, कुछ बच्चे हैं जो मेहनत करते हैं रह जाते हैं, तो वो अलग चीज़ है। बाकी आप देखोगे ना तो 50-60% बच्चा जो मेहनत कर रहा है ना वो पास हो रहा है, बाकी कुछ बॉर्डर पे रुक जाते हैं 140-150 के आसपास, तो वो बेचारे बदकिस्मत है। बाकी मोस्टली मेहनत करने वाले 140 से ऊपर वाले ही बच्चे सब मेहनत ही कर रहे हैं। तो कभी कभी ऐसा आप देखोगे कि पेपर जितना मर्जी टफ आ जाए, बट आप लोग इतनी मेहनत कर रहे हो, इतनी मेहनत कर रहे हो कि आप पास हो रहे हो उस पेपर में। एंड आई एम सेइंग कि ये स्क्रीनिंग एग्जाम जैसा पेपर नहीं है, मतलब वो आपको स्क्रीन नहीं कर रहे हैं, वो तो आपको सीधा कॉम्पिटिटिव एग्जाम ले रहे हैं एक तरह से। तो ऐसा क्वेश्चन पेपर आइडियली स्क्रीनिंग के लिए नहीं होता है, बट क्या कर सकते हैं, वो लोग बना रहे हैं तो बना रहे हैं। तो नाउ लेट्स सी द नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 5। In question number 5, something related to aspirin overdose was asked. Aspirin overdose. Now can you tell me what was the exact question? Something related to aspirin overdose was asked. I think most probably they asked about the treatment, because in this there is metabolic acidosis and respiratory alkalosis. Metabolic acidosis and respiratory alkalosis. So metabolic acidosis and respiratory alkalosis. If they ask the treatment, then obviously soda bicarb. Okay, soda bicarb. Aspirin overdose. One question was asked from the labetalol. Can you tell me what was the question related to labetalol? Because one question was there from the labetalol and one question was there from the, in labetalol there were 2 questions. One is regarding the preeclampsia and one is about the hypertension emergency. So what was the question? And one question was related to warfarin, patient of valvular heart disease. Patient of valvular heart disease. So patient of valvular heart disease going for surgery, what you will do? Something like that. So next step, क्या करना चाहोगे? So these 2 questions were there from the labetalol and from the warfarin. So labetalol is one of the frequently asked question. So can you let me know कि बेटा एग्जैक्ट क्वेश्चन क्या था लेबेटालोल पे, क्योंकि देयर वाज ए क्वेश्चन फ्रॉम द लेबेटालोल, मोस्ट प्रोबब्ली प्रीएक्लेम्पशिया। कुछ बोल रहे हैं कि 2 क्वेश्चन थे, कुछ बोल रहे हैं 1 क्वेश्चन था, बट प्रीएक्लेम्पशिया और इमरजेंसी हाइपरटेंशन पे क्वेश्चन थे। इन वारफरिन एज पर द रिकॉल स्टूडेंट्स बोल रहे हैं कि बेटा सर वाल्वुलर हार्ट डिजीज दिया हुआ था और पूछा था कि अगला स्टेप क्या करोगे। तो बेटा इसमें अगला स्टेप क्या करेंगे, तो ऑब्वियसली अगर सर्जरी के लिए आप जा रहे हो तो हम पहले उसको चेंज कर लेंगे LMW हिपेरिन पे, क्योंकि वारफरिन तो रिस्की ड्रग है एंड वारफरिन स्टॉप भी करना होगा तो 4-5 दिन पहले करना पड़ेगा, जो कि वाल्वुलर हार्ट डिजीज में सेफ नहीं है। सो LMW हिपेरिन, डॉक्टर सेल्फी बेटा आप बता दो। हमेशा याद रखो लाइफ में ग्रेटिट्यूड बहुत इंपॉर्टेंट है। सो LMW हिपेरिन, आप डॉक्टर बनने वाले हो, ऑलवेज यूज द लैंग्वेज ऑफ डॉक्टर्स। ओपन पब्लिक प्लेटफॉर्म पे कभी भी अभद्र भाषा का इस्तेमाल नहीं करना चाहिए। स्टूडेंट हैं, रिकॉल भी करेंगे, सब कुछ होगा, नहीं तो पार्ट ऑफ लाइफ, बच्चे सबको धीरे धीरे चीज़ें याद आएंगी। तो LMW हिपैरिन पे शिफ्ट कर देंगे पेशेंट, एंड LMW हिपैरिन विल बी गिवन। ओके, तो लेबेट्रॉल पे था, एक्लेम्शिया पे क्वेश्चन, तो डेफिनेटली ठीक है बेटा। DVT भी था तो भी LMW हिपैरिन पे शिफ्ट करना ही पड़ेगा, बिकॉज वारफरिन तो यू नीड टू स्टॉप एटलीस्ट 4-5 days। LMW हिपैरिन इज द सेफ ऑप्शन, तो you will shift the patient to LMW heparin and then on the 1 day before surgery you can stop it। कल हम आपको एग्जैक्ट ऑप्शन के साथ भी बता देंगे कि क्या क्या ऑप्शंस थे और क्या उसमें से आपको करेक्ट मोस्ट करेक्ट होना चाहिए था, बट अभी मैं आपको आइडिया दे रहा हूँ कि किस टाइप के क्वेश्चन थे और क्या आंसर हो सकता है। नाउ कम्स टू द नेक्स्ट, देयर वाज ए क्वेश्चन फ्रॉम द, और देख लेते हैं बच्चों ने क्वेश्चन भेजे हुए हैं कुछ। ओके, एक क्वेश्चन था बेटा इंटरलोकिन 2 इनहिबिटर पे, इंटरलोकिन 2 इनहिबिटर। वन क्वेश्चन फ्रॉम द बोर्टेजोमिब, बोर्टेजोमिब। वन क्वेश्चन फ्रॉम द बोर्टेजोमिब, one question from the loperamide, loperamide। So what was the question? ओके, पंकज बोल रहा है कि सर यहाँ पे 5 दिन पहले सर्जरी के स्टॉप करना था, ऐसा करके था। बेटा 5 दिन पहले हम स्टॉप नहीं कर सकते ना, वही हमने बताया कि फिर तो रिस्क हो गया। अगर पेशेंट पहले से वाल्वुलर हार्ट डिजीज पे तो पेशेंट को फिर आपको शिफ्ट करना पड़ेगा LMW हिपैरिन पे। ओके, मतलब डोज वाला क्वेश्चन पूछा बोला, ठीक है ठीक है। ओके, तो इंटरल्यूकिन 2, तो बेटा इसमें 2 ड्रग होती है, वन इज बेसिलिक्सीमैब, बेसिलिक्सीमैब, एंड वन इज डैक्लीजुमैब, डैक्लीजुमैब। तो बताओ क्या था ऑप्शन में, या तो बेसिलिक्सीमैब होगा या डैक्लीजुमैब होगा, तो बेसिलिक्सीमैब और डैक्लीजुमैब। एंड बोर्टेजोमिब इज वन ऑफ द प्रोटियोसोम इनहिबिटर, it is one of the proteasome inhibitor and it is approved for multiple myeloma, it is approved for multiple myeloma। ओके, तो प्रोटियोसोम इनहिबिटर बोर्टेजोमिब पे डायरेक्ट क्वेश्चन था। हमने अपने DFX में आपको बताया भी था कि बस 1-2 चीज़ें याद कर लो आउट ऑफ द टारगेटेड थेरेपी, जिसमें हमने बताया जैक इनहिबिटर and proteasomes inhibitor। So this is proteasome inhibitor। What was the question on loperamide? बिकॉज बच्चों को एग्जैक्ट याद नहीं आ रहा कि क्वेश्चन तो था लेकिन क्या था वो नहीं पता। देन द क्वेश्चन वाज फ्रॉम द एंटीफंगल, एंटीफंगल्स लाइक एम्फोटेरेसिन बी, एम्फोटेरेसिन बी एंड फ्लूकोनाजोल, एम्फोटेरेसिन बी एंड फ्लूकोनाजोल। वन क्वेश्चन वाज फ्रॉम द लिथियम, वन क्वेश्चन वाज फ्रॉम द बायो अवेलेबिलिटी, बायो अवेलेबिलिटी। One question was from the bioavailability. One integrated question was there, integrated question regarding the syphilis, syphilis treatment. syphilis treatment. तो बेटा about the syphilis treatment, integrated question from the syphilis treatment. तो इन syphilis treatment बोल रहे हैं कि सर अल्सर दिया हुआ था, lesion was given, painless lesion was given, and treatment. The treatment is obviously benzathine penicillin. I think benzathine penicillin सबने ठीक किया होगा. benzathine penicillin. Okay. One question is related to first order kinetic. Okay. तो बायो अवेलेबिलिटी, फर्स्ट ऑर्डर काइनेटिक, दो क्वेश्चन जनरल फार्मेक से हो गए. लिथियम हेलोपेरिडोल एंटीसाइकोटिक से हो गए. एंटी फंगल, राइट. तो टॉपिक तो वही है जो एक्सपेक्टेड टॉपिक है, बट एग्जैक्ट क्वेश्चन थोड़े से लेंथी थे. तो वो आप बता सकते हैं कि क्या क्वेश्चन था, क्योंकि अभी तक रिकॉल तो चल ही रहा है. हम तो खुद तंग नहीं करते किसी को भी. हम बोलते हैं कि भाई जब जब याद आता जाए आप बताते जाना, फिर हम आप एग्जैक्टली बता देंगे कि आंसर क्या उसका हो सकता है. लेकिन आपको आइडिया दे रहे हैं कि क्या क्या क्वेश्चन आए थे, ताकि आप रिकॉल कर सकेंगे. क्योंकि आपके दिमाग में आएगा कि ये क्वेश्चन आया था, देन डेफिनेटली यू विल बी एबल टू रिकॉल. ओके. वन क्वेश्चन वाज समथिंग रिलेटेड टू पल्मोनरी इडीमा. And one question is from the UTI. In UTI they asked the treatment and ciprofloxacin was asked. Yeah, I can understand Swati. क्वेश्चन देखिए, मैं तो खुद ही बोल रहा हूँ कि टफ थे, मुश्किल थे, लैंग्वेज इशू था, बट जो भी था हमें तो देखना है कि अपना स्कोर चाहिए, पास हुए निकल लेना बस. तो अराउंड 20 क्वेश्चंस वर देयर फ्रॉम द ड्रग्स, एंड स्टूडेंट्स आर सेइंग कि सर मैनी क्वेश्चंस वर इंटर सब्जेक्ट इंटीग्रेटेड, कि उसके साथ में उसका मतलब ड्रग्स पे बहुत सारी चीजें थी, लेकिन आपस में मिला जुला के पूछा हुआ था. So these were the topics which have been asked. Now try to recall these topics. Okay, cell cycle. So G1S G2M, something related to this. G1S G2M. One question, something related to restlessness. ओके. धीरे धीरे याद आ रहा है आप लोगों को, बट पूरा अभी भी रिकॉल नहीं कर पा रहे. ओके. मैसेज तो आपके लगातार आ रहे हैं. रेनिन इनहिबिटर. ओके, नो प्रॉब्लम. आपको मैंने टॉपिक का हिंट दे दिया है, इन टॉपिक्स को सोच लिएगा, एंड अकॉर्डिंगली हम देख लेंगे कि जो है क्या क्वेश्चन, सारे ऑप्शन मिला मिलो के, और टुमारो विल गिव द प्रॉपर वीडियो विद ऑप्शंस, बेस्ट पॉसिबल ऑप्शंस एंड द करेक्ट आंसर. ठीक है. ओके. रेस्टलेस लेग मेंशन था, तो जो भी याद आता है आप जो है भेज सकते हो. अगर आप हमारे डैम्स के स्टूडेंट हो तो हमारे डैम्स के ग्रुप पे भेज दो, नहीं तो यू कैन डायरेक्टली सेंड मी. to this WhatsApp number, so that we can do the proper recall. This was just to give you the idea which topics were asked, so that you can collect the question or you can recall the questions and then we can discuss. Okay, lock struck. Rockstar pathway. Okay, जी.
Hi, good evening. Good evening. Hi, good evening. Good evening. How was micro? Hope you people are very tired, morning to evening, continuously writing exam. But you have the enthusiasm. How much questions is right? What the question they asked? It is just first-hand information from you people, and you are the people who wrote the exam. You know exactly what is the wording, what is the question. You know, even small word can change the answer. For example, one word called except or not, answer is totally different. Like that, I got first hand information. One question is image based question. They gave this kind of image. I don't know which image they gave, but I got the information. This image is cytomegalovirus. I don't know about the other choices also. Cytomegalovirus. It is owl eye inclusions. I don't know the history. Please send me the history and other thing and all. I will get back you with complete version of questions. Aram say people send all the questions. We will frame question with the choices. We'll put everything together. First hand information. If we got a question like this, cytomegalovirus, because it is owl eye inclusions. This kind of picture they ask any other picture. Let me know in the chat box. One option is EBV, cytomegalovirus. Yes, option EBV, cytomegalovirus, and other options. EBV history was there. Very different picture. What picture they asked? It is anything Reedstenberg cell or atypical lymphocyte. Send me the picture. You search in Google. Atypical lymphocyte means totally different. Or Ballarat Downey cell. If it is Downey cell, total diagnosis is different. That may be EBV. Okay, it does not look like this thing. It was single eye picture, not the like this. Okay, we'll change it, not an issue. People sense a cytomegalovirus owl eye appearance. This is the only clue we got. You people just you can sit and you can give the feedback. Based on your feedback, we will modify. One question, blood culture, they gave the bottle like this. Not exact bottle, they say it is called biphasic medium. This is solid phase, this is liquid phase. Biphasic medium, okay, for Castaneda biphasic medium, for Brucella. The organism is Brucella. You write the exact question and the other options. We will make it perfect. Very big nucleus, you can think. Very good. Castaneda biphasic medium, Brucella. These are all from notes as well as our DFX. See the DFX. I'll put the same biphasic medium, vertebral osteomyelitis, brucellosis, everything we made. Next is food, flood, rodent, and fever. Where there is a flood, rodent, and fever, or if conjunctival suffusion is there or not, even though it is not there, leptospirosis is the option. Leptospiro question was there. Yes, you are right, Dr. Sinu Jaiswal. Already I made it. Leptospirosis. Another choice they gave dengue. I don't know about two choices. Please DM me. I'll give my personal number, WhatsApp number. You direct message. Based on that, you can help the other people and you can titrate your marks. Leptospira. Mumbai flood. Yes, okay, I'll write Mumbai. Mumbai flood, rodent, fever, leptospira. That's all. Great. Next is typhoid fever testing. The mnemonic is BASU. First week, blood culture, not plague. Plague is not due to rat directly. It is due to rat flea bite. Rat flea bite. Second week, antibody testing, Vidal test. Third week, you can go for stool culture. Fourth week, urine culture. I want the exact thing. I got the only clue. Sir, typhoid fever testing, they ask, Basu is helping us. We don't know exact question. Please send me. And some the people ask diphtheria question. What diphtheria? Diphtheria means what question they ask from diphtheria? That is, oh, diphtheria option was there. Okay. Diphtheria option was there. There, previous one. Good, 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 good. I'll write it. Don't worry. Next is dog bite category and management. If multiple bites, category 3 bite, and they gave some image also, category 3 bite, multiple bite or bleeding, you can go for vaccine plus rabies immunoglobulin with wound cleaning. Many times we discuss the answer. Sir, one was there, the history of surgery and patient returned with diarrhea after some day, something like that. Patient with diarrhea, I'm writing here. Patient, surgery, diarrhea. Clostridium is difficile. Clostridium is difficile. Pseudomembranous enterocolitis. Okay, right. So it was bleeding, but dog was immunized. Even though immunized, if there is a bleeding, it is category 3 only. Vaccine with rabies immunoglobulin with wound cleaning. Even though the dog is vaccinated, you need to give vaccine for human being. Bleeding means category 3 bite. Good. And they gave one picture called Etshore. Etshore produced by anthrax. Anthrax toxin. Always we remember toxin mechanism of action they will ask. Always toxin mechanism of action. It is increasing cyclic AMP, that is called edema factor. I don't know what exact question. Category is not asked, but what treatment they asked. They said treatment asked. In case of bleeding, it comes under category 3. The treatment will be vaccine with immunoglobulin. Rabies vaccine with immunoglobulin. Wound was lacerated. Very good. Lacerated wound means definitely it is vaccine with immunoglobulin. Next is what anthrax question. Mechanism of action of anthrax toxin. Cyclic AMP. Lethal factor. Necrosis. Yes or no? These are easily you can answer. Micro question, you take your notes, you can see everything from the notes because I got the feedback from the kids. They're happy in micro, overall they are not happy. Paper 1 is tough. I heard the real honest feedback from the kids. Paper 1 is hard, paper 2 is acceptable, micro is easy, sir. This is the thing I got. Okay, right. Capsulated hemotoxin. One option, two things was option. Polysaccharide capsule is virulent factor. And what is the fourth one? Another one is I'm writing here the choice. Hemotoxin. We'll check it. I'll check it with other choices. I'll finalize. Because anthrax capsule is the important virulent factor that is called what toxin? Polypeptide capsule. Okay. Only micro and patho was okay, but overall tough. Don't worry, if it is tough to you, it is tough to everyone. Always remember. Don't be panic. Aram say sit and think. Next is hand, foot, mouth disease. One question came. Yes or no? Egg related. Egg picture was given. It is on the way, my dear. Dr. Ahmad, egg picture is on the way. I'll make the egg picture. You check the egg picture. Hand, foot, mouth disease. Coxsackie virus. Vesicles. Painful inguinal lymphadenopathy is bubo. Is bubo. LGV. Possibilities are there. LGV. Coxsackie. Very good. Very good. Two questions are very good. Flea. Painful inguinal. Then I can go for plague. Rat flea. Rat flea, bubo. Then I can go for plague. Then it is plague. Coxsackie marked. You are right, my dear. Coxsackie is correct. This Coxsackie A virus. Perfect. I'll make it. I'll make all the things. Now I'm getting the base from you. From with your base, I can collect some other thing. I will call you also some of the kits. Okay. Vector was asked. Flea. Rat flea. Very good. Rat flea. I always used to tell one vector question will come. One mechanism of action of toxin will come. One egg picture will come. Definitely. Anyway, I'm happy. Coxsackie A, my dear, not Coxsackie B. Coxsackie A. Next is rhinosporidiosis culture medium. No culture medium. That is the answer. Because it is now protozoa. No culture medium. Rhinosporidium, no culture medium. Acute hepatitis, yes, always hepatitis serologies. See, you believe it or not, just to you scroll the Insta and check Dr. Surya's predictor series. I say just to read 5 topics. You check 5 questions came or not. Okay, my dear? Right. No culture medium for rhinosporidium. Very good, very good. And acute hepatitis, they asked. I want to get the full question. It is anti-HBC, IgM with hepatitis B, surface antigen. If it is present, it is acute hepatitis. Another question. Great, great, great. Acute viral question was there, sir. Very good, very good. Integrated with medicine. Yes, everything is same. River blindness caused by onchocerca valvulus. It is caused by onchocerca valvulus. Vector is Similium fly. River blindness caused by onchocerca valvulus. Live direct question. Yes, hepatitis B surface antigen and IgM. Close the file, it is acute hepatitis. These are all totally expected questions, my dears. Next is HIV positive pneumonia, yeast inside the macrophage. Many times we taught yeast in macrophage. Go for histoplasma capsulatum. Wilflix test, fever, headache. You can go for rickettsia. Rickettsia, Wilflix test. I will write it here. Anyway, I will ask the kids exact question. Headache, rickettsia. Yes, Dr. Sinu. Pathogen seen eyes. What is the infective? Like question was like a pathogen seen in eyes. That's the first question. People say Epstein-Barr virus. I will get the exact. You also search in Google. Please help me send the picture. We'll get the correct answer. Toxic shock syndrome. What is the question? Because I got the key words. Whether the toxic shock syndrome is the answer or question, I don't know. Just I want a clarification from you. Toxic shock syndrome. सर आप एक हीरो जैसे लगता है. Thank you very much. God bless you. Options were related to nucleus. I will check, my dear. Sinu. Toxic shock syndrome. A dog question we discussed. Lacerated wound, dog bite, management. We discussed. Don't worry. Till now we got some 20 questions. Hey, what is the question for toxic shock syndrome? Can anyone make? Option toxic shock syndrome. Answer. Then what about the question? Anything called women using vaginal tampon? A super antigen. Very good. Very good. Super antigen. I made a separate slide for you, super antigen and DFX. You check. Super antigen, I made a separate slide and give examples. Is classical example, toxic shock syndrome, toxin. Very good, very good, very good. Japanicum is on the way. How many intermediate hosts for the pathogen? Lateral spine, schistosoma, japanicum. One intermediate host, that is snail. One intermediate host, snail. You are a dog. I'm so faithful to my people. So if people call me dog, you are a dog. Is it compliment statement or you are scolding me, Dr. Chinmaya? Got it? Right. Next is lupus nephritis. SLE, lupus nephritis, belong to type 3 hypersensitivity. Lupus. Super antigen, yes, we have discussed. Intermediate host for this is snail. It is how many intermediate host? One intermediate host. Next is history of person from northeast. Okay, okay, okay. Next is, see here, type 3 hypersensitivity. Type 3 hypersensitivity. Next is Vibrio cholera mechanism of action of toxin. It stimulates adenyl cyclase. Increasing cyclic AMP, stimulating GS. I don't know which option they gave. Snail and crab. Option was, wait. No, but other option was Japanicum not given. Snail and crab. In case of Westermani, you are right. Vibrio cholera mechanism of action. Adenyl cyclase, increasing cyclic AMP. Elongation factor 2 is for diphtheria as well as pseudomonas. Diphtheria as well as pseudomonas. I'll check it. Okay. And quality control agent for autoclave is Geobacillus. Direct question. These are all direct question. Geobacillus stereothermophilus. Geobacillus stereothermophilus. Yes, GM1. Very good. GM1. Stimulatory. GM1 is Vibrio cholera mechanism of action of toxin. Cyclic AMP, my dear, not cyclic GMP, cyclic AMP. Autoclave, is it image based? Yes, plasma steroid also the quality control agent is geobacillus stereothermophilus. Plasma steroid, okay, right, I will write. Plasma sterilization, quality control agent, same, geobacillus stereothermophilus. Geobacillus stereothermophilus, very good. And one question from group A, beta hemolytic streptococcus. What question? Anything rheumatic fever? Anything on toxin? Anything glomerular nephritis? Yes, I mentioned already. Microworld, this question was there. Yes, quality control is geobacillus stereothermophilus. My mobile number 9894010207. You please take down. WhatsApp me. You WhatsApp me, mention your name. I will acknowledge you. Micro was good. Thank you very much. And I don't want to take much of your time. You're already tired. And other faculty also ready to discuss some important points to you. And keep in touch with me. Okay. Anyway, now I am signing out. Don't worry. This is my mobile number. You please WhatsApp me. Because of your material only, I'm going to produce all those things. I want to full question. Each one contribute at least one full questions, please. Thank you.
Wish you all a very good evening, guys. I know you might not be in a right mental state to discuss the recall sessions, but just give me a thumbs up, guys. I know not at all. This is not the right time to discuss. I know बहुत difficult था paper. It was not on the easier side at all. The options were not at all on the easier side. Whatever I could recall, I could collect the questions. Thank you so much. पर एक बार थोड़ा सा, I know overall the paper was very difficult. What about pathology? I hope the pathology was not the one to disappoint you at all. एक बार थोड़ा सा हिंट दे दो ओवरऑल, जिस तरह पेपर था, जिस तरह हम सुन रहे हैं, वीडियो बेस्ड क्वेश्चंस, न्यूमेरिकल क्वेश्चन पीएसएम से, ओवरऑल फीडबैक अबाउट पैथोलॉजी वाज, आई नो पेपर वाज वेरी डिफिकल्ट, पर पैथोलॉजी को लेकर मुझे दे दो, बहुत ही शानदार क्वेश्चन थे, ग्रेट. तो चलो गाइस, आई विल नीड योर इनपुट. क्वेश्चन को पढ़ते चलो, डायग्नोस करते चलो. आइडेंटिफाई द इमेज, प्लीज गिव इट द इनपुट. जो इमेज थी, जो क्लिनिकल हिस्ट्री थी, प्लीज डू लेट मी नो. फर्स्ट इमेज, ये तो आई एम श्योर ऑल ऑफ अस आर टेलिंग मी दैट सर आउटलाइन अपीयरेंस आया था, सीएमवी था, राइट और रॉन्ग? बेस ऑफ इंक्लूजन से ईबीवी पे 2 क्वेश्चन है. थैंक यू. प्लीज कीप गिविंग मी द इनपुट्स. ईबीवी पे क्या क्वेश्चन आया था? वन तो आई नो क्या क्वेश्चन थे. माइक्रोवर्ल्ड, जहां आपको लगे ऐसा क्वेश्चन नहीं था. ईबीवी पे 2 क्वेश्चन से. कैन यू प्लीज टेल मी क्या क्वेश्चन थे ईबीवी के ऊपर? आई विल आस्क यू गाइस. सिंगल आई थी, ओके, सिंगल आई थी, पर सीएमवी था, बेसोफिलिक इंक्लूजन था, राइट? अगर बेसोफिलिक इंक्लूजन था तो इट इज सॉर्टेड हो गया, आंसर हो गया सीएमवी. सिनू, ईबीवी पे क्या क्वेश्चन था? वेटिंग फॉर यू गाइस टू रिस्पॉन्ड. यार प्लीज बताओ मेरे को. मेरे को ईविंग्स का क्वेश्चन मिला है, ईबीवी पे सीएमवी का क्वेश्चन मिल गया मुझे. सीएमवी पे था, राइट? आई एम डूइंग मच बेटर जयवीर, थैंक यू सो मच डार्लिंग. चलो, 8 ईयर ओल्ड चाइल्ड, लॉस ऑफ ई कैड्रन. ऑप्शंस क्या थे? लॉस ऑफ ई कैड्रन से लोबुलर ब्रेस्ट कैंसर था, माइक्रोवर्ल्ड या डिफ्यूज गैस्ट्रिक कैंसर था. ओके, आरएस सेल्स आर एसोसिएटेड विद RS cells are associated with classical Hodgkin. So meet 2910 क्लास RS cells के साथ क्वेश्चन क्या था? Did they ask the variant of Hodgkin lymphoma or was just Hodgkin lymphoma in the option? Microworld, meet 2910. मुझे इतना बता दे बस. Reed Sunberg cells are associated with. Did they ask Hodgkin, non-Hodgkin like this, or did they ask the variant of Hodgkin lymphoma? Diffuse gastric cancer. Thank you. पैथो वॉज डूएबल, आई टेक इट एज अ कॉम्प्लीमेंट. मुझे नहीं लगता किसी बच्चे ने मुझे अभी तक कोई ऐसा क्वेश्चन बताया जो हमने नहीं पढ़ा. अगेन सेइंग ऑल दिस, आई नो उस ट्रिकी क्वेश्चन में से पिन पॉइंट करना वुड नॉट हैव बीन एन इजी टास्क. यहां बैठ के बोलना वुड हैव बीन वेरी यूजफुल. ओके, आंसर वाज हॉजकिन लिम्फोमा. थैंक यू सो मच. और भी कुछ याद आए तो बताते रहना. 8-year-old child, painless lymphadenopathy and starry sky appearance was given. Yes or no? Was starry sky directly mentioned? There was no HP image, right? There was no image. Was there image of starry sky appearance? या उन्होंने लिख दिया था starry sky appearance. ये क्वेश्चन था या नहीं? Thank you, Nictophile. In an exam like this, if I could hear this line that patho was very easy, I will take it as a compliment. ओके, इविंग्स की ट्रांसलोकेशन पूछी गई थी, राइट? ये क्वेश्चन था ना. ओके डन. चलो नेक्स्ट पे आते हैं. 3-year-old टेस्ट. नाउ हियर आई हैड थोड़ा सा कंफ्यूजन. बच्चे कह रहे हैं बच्चा दे रखा था टेस्टिकुलर मास, पेनलेस टेस्टिकुलर मास. बच्चा था विद पेनलेस टेस्टिकुलर मास एंड AFP रेज्ड. बच्चा था, AFP का लेवल रेज था. फिर लिखा हुआ चला गया. क्या हो रहा है? AFP नॉर्मल था. जॉ की हिस्ट्री थी. ओके, यहां पे जॉ हिस्ट्री थी. चाइल्ड क्वेश्चन में था, ठीक है सर, थैंक यू सो मच. अच्छा, प्लीज टेल मी दिस क्वेश्चन. AFP वाज नॉर्मल, तो आंसर वाज, एक चाइल्ड थी तो आंसर वुड हैव बीन सेमाइनोमा. यस और नो? जो टेस्टिकुलर मास पे क्वेश्चन आया था, आंसर वाज सेमाइनोमा. एक भी बता दो मेरे को. 3 year था या नहीं था? एंड AFP वाज नॉर्मल. नॉर्मल बीटा FCG एंड AFP नॉर्मल. ओके डन. नॉर्मल AFP, नॉर्मल बीटा FCG. फिर तो आंसर इज डन. सब बच्चे कह रहे थे सर सेमाइनोमा आंसर था, पक्का था, पर AFP रेस था. चलो डन, थैंक यू सो मच. नेक्स्ट पे आते हैं. बर्किट्स पे ट्रांसलोकेशन पूछी गई थी. यस और नो? वाज देयर 2 क्वेश्चन बर्किट्स लिम्फोमा? भूल जाओ यार. डॉक्टर सेल्फी एम्प्रोवर, ये जो मैं आई एम नॉट अलाउड टू यूज द नेम, जो सेल्फी इंप्रूवर पूछ रही है मुझसे, ये पेपर देखने के बाद समझ में आ चुका है. वी ऑल हैव गेट टू नो, डोंट जस्ट फोकस ऑन द रैपिड रिविजन्स, फोकस ऑन कंसेप्ट्स, फोकस ऑन मेन नोट्स. हर बार तुम्हें FMG यही सिखाना चाह रहा है कि सिर्फ रैपिड रिविजन के, चाहे वो किसी भी प्लेटफॉर्म के, मैं किसी का नाम नहीं लूंगा, बट मेक श्योर आपके कंसेप्ट ठीक हों. आप वो जमाने गए कि सिर्फ आप मेन लाइनर्स याद करके क्वेश्चन सॉल्व कर सकते हो. How many video questions were there? चलो डन. 814 था, बर्किट्स पे आते, ये भी डन. आई हैड, देयर वाज क्वेश्चन ऑन 1221 आल्सो. इज इट यस और नो? 1221 पे क्वेश्चन था या 821 पे क्वेश्चन था क्या? देन ये भी मुझे हिस्ट्री मिली थी. पेशेंट हैड अ गम ब्लीडिंग एंड बेसोफिलिक स्टिपलिंग वाज गिवन, एंड उन्होंने पूछा था लेड पॉइजनिंग है या आर्सेनिक पॉइजनिंग है. यस और नो? गम ब्लीडिंग के साथ आया था एंड बेसोफिलिक स्टिपलिंग वाज गिवन, एंड ऑप्शन में था बेसोफिलिक स्टिपलिंग के कि वेदर द पेशेंट हैड आर्सेनिक पॉइजनिंग और लेड पॉइजनिंग. ऐसा क्वेश्चन याद आ रहा है सबको? एंड आंसर वाज लेड पॉइजनिंग। बेसोफिलिक स्टिपलिंग है, हम सबने अच्छे से पढ़ा है, डीएफएक्स में पढ़ा, मेन नोट से पढ़ा कि बेसोफिलिक स्टिपलिंग इज द फीचर ऑफ लेड पॉइजनिंग। परफेक्ट परफेक्ट, थैंक यू माइक्रोबल। चलो डन, ये क्वेश्चन भी डन है। नाउ वी हैड अ क्वेश्चन ऑन एस्बेस्टोसिस आल्सो। पेशेंट वर्किंग इन शिपयार्ड इंडस्ट्री डेवलप्स डिस्निया प्लूरल थिकनिंग मेथड एंड आंसर वाज एस्बेस्टोसिस। हर बच्चा इज टेलिंग मी सर एस्बेस्टोसिस पे क्वेश्चन था, कैन यू थोड़ा सा गिव मी द हिस्ट्री, कुछ हिंट याद आ रहा है कि सर इतना याद है शिपयार्ड इंडस्ट्री में था, डिस्निया के साथ आया था, मेसोथेलियोमा मेंशन था क्या, फेरुजिनस बॉडीज मेंशन था क्या, लोअर लो मेंशन था क्या, एनी रेलेवेंट हिस्ट्री दैट यू कैन गिव मी अदर देन शिपयार्ड वेयर आंसर वुड कंफर्म मी दैट पेशेंट हैड एस्बेस्टोसिस ओनली। सोचो सोचो सोचो, आई एम वेटिंग फॉर योर आंसर। लोअर लो मेंशन था। परफेक्ट परफेक्ट, लोअर लो भी था, शिपयार्ड भी था। बस अब बच्चे की जान लोगे क्या? डन है ना? डन है, आंसर एस्बेस्टोसिस है। चलो नेक्स्ट क्वेश्चन मुझे जानना है, वायर लूप प्लूशन पे क्वेश्चन था क्या? नाउ आई गॉट टू क्वेश्चन ऑन दिस कि एक हाइपर सेंसिटिविटी रिएक्शन वाज आस्क्ड, व्हाट इज इट सेल्फी एम्पावर? वायर लूप प्लूशन लूपस नेफ्राइटिस में वाज हाइपर सेंसिटिविटी आस्क्ड और दे आस्क्ड अबाउट वायर लूप प्लूशन। स्टूडेंट्स टोल्ड मी सर वायर लूपस नेफ्राइटिस पे क्वेश्चन था। लूपस नेफ्राइटिस पर हैड टू इनपुट्स, एक कह रहा है सर हाइपर सेंसिटिविटी रिएक्शन आया था, एक कह रहा है वायर लूप प्लूशन आया था। स्वास्तिक इज टेलिंग अस सर सिलिका डस्ट पे भी ये क्वेश्चन था, सिलिका डस्ट पे भी। माय डियर फ्रेंड्स, आई एम आस्किंग यू टू क्वेश्चंस, प्लीज कमेंट, क्या सिलिकोसिस पे भी क्वेश्चन था? सर आपको क्या हुआ है? मैंने आपको पहले बताया मेरे गर्दन का सिजेरियन हुआ है, मेरे गर्दन में से एक बच्चा निकला, अभी भी उसका मैं बाप बना हूं। Darling, I had a severe cervical injury, C4, C5, C6, C5, C7 vertebra, and I had been operated for that. हाँ था, सिलिका भी एक था। गाइस सिलिकोसिस पे कुछ बच्चे कह रहे हैं, जो बच्चे कह रहे हैं हाँ सर सिलिकोसिस पे क्वेश्चन था, कैन यू गिव मी थोड़ा सा इनपुट, क्या था सिलिकोसिस पे क्वेश्चन? हैंड पे आर्थराइटिस की फोटो थी, ऑप्शन था न्यूरोफाइब्रोमेटोसिस 1, तो न्यूरोफाइब्रोमेटोसिस 1 पे क्वेश्चन था, दैट मेडिसिन वी डिस्कस। सिलिका वाज अ डिफरेंट क्वेश्चन। स्वास्तिक कोई बता सकता है, किसी को याद आ रहा है? मुझे ऐसे दो चीज जाननी है, एक सिलिकोसिस पे क्या क्वेश्चन था और दूसरा लूपस नेफ्राइटिस की हाइपर सेंसिटिविटी आई थी क्या? सर एक क्वेश्चन था जिसमें C3 लेवल और SLE की प्रेजेंटेशन था, SLE की प्रेजेंटेशन था, ऑप्शन में था एंटी GBM और इम्यून कॉम्प्लेक्स डिपोजिशन करके। ओके डन, थैंक यू सो मच। सो बेसिकली इट वाज नॉट डायरेक्टली हाइपर सेंसिटिविटी, SLE की पैथोजेनेसिस पूछी थी। Pathogenesis of SLE and answer is immune complex deposition, right? Do everybody agree to that? Immune complex deposition. Other options were IgG antibodies, anti-GBM antibodies. IgG anti-GBM. ये डाई वाला क्या क्वेश्चन था? डाई इंडस्ट्री में काम कर रहा था एक बंदा, ऐसे क्वेश्चन आया था। लव यू, मुझे बता दे डाई इंडस्ट्री पे क्वेश्चन क्या आया था? व्हाट एग्जैक्टली वाज द क्वेश्चन? क्या वो डाई इंडस्ट्री के नेप्थेलामाइन पे कार्सिनोजन था? डाई इंडस्ट्री से कैंसर पूछा था? डाई इंडस्ट्री से क्या पूछा था? प्लीज समबडी हैज टू हेल्प मी आउट विद दिस। फैट एम्बोलिज्म से भी क्वेश्चन था, थोड़ा सा मेरे को बता दो, फैट एम्बोलिज्म पे क्वेश्चन क्या था? डू एवरीबॉडी एग्री? प्लीज, किसी को याद है क्वेश्चन ऑन डाई इंडस्ट्री एंड क्वेश्चन ऑन फैट एम्बोलिज्म? क्वेश्चन ऑन फैट एम्बोलिज्म। सर मैं पास पक्का हो जाऊंगा। थैंक यू सो मच डार्लिंग, आई नो आई लव पीपल विद द पॉजिटिव मैनिफेस्टेशन। आई एम हैप्पी एंड आई एम श्योर यू विल पास बाबा। कोई तो दिखा जो श्योरली बोल रहा है कि मैं पास हो जाऊंगा। विनाइल क्लोराइड और नेप्थेलामाइन, ओके। तो डाई इंडस्ट्री में था, दे आस्क्ड कार्सिनोजन। ओके डन है, फिर तो डायरेक्ट नोट्स मिल गया, थैंक यू सो मच। डीएफएक्स में भी पढ़ लिया था, एन आंसर इज नेप्थाइलामाइन। थैंक यू सो मच, डन है सर। एक आंसर था लीवर एंजियोसार्कोमा भी क्वेश्चन था, क्वेश्चन ऑन लीवर एंजियोसार्कोमा। प्लीज मुझे बता दो, डू एवरीबॉडी एग्री? फीमर फ्रैक्चर, लीवर का एंजियोसार्कोमा था। सर समथिंग लाइक दिस, बेंजिडीन वाज। अब मुझे दो ऑप्शन मिलने को आ गए हैं। आई नीड योर ओपिनियन गाइस। was it benzidine in the option or was it nephthylapine in the option? Please tell me guys, I need a help. डाई इंडस्ट्री में ऑप्शन में बेंजीडीन था या ऑप्शन में नेप्थाइलामाइन था? प्लीज। ओके लेट्स वेट फॉर द इनपुट्स। नेप्थाइलामाइन था या बेंजीडीन था? और लीवर एंजियोसार्कोमा पे आर्सेनिक था या पॉलीविनाइल क्लोराइड था? वीएचएल पे भी क्वेश्चन था, बेंजीडीन, डन, आंसर वाज बेंजीडीन। चलो फिर तो और इजी हो गया। हमने पढ़ा था बेंजीन ल्यूकीमिया, बेंजीडीन ब्लैडर कार्सिनोमा। बेंजीडीन वुड डेफिनेट, और डिड दे मेंशन ब्लैडर का वेरिएंट ट्रांजिशनल सेल कार्सिनोमा है या स्क्वामस सेल कार्सिनोमा है? चलो डन है। प्लीज वन लास्ट थिंग, लीवर एंजियोसार्कोमा में पॉलीविनाइल क्लोराइड था या आर्सेनिक था? If so, there was a question on liver angiosarcoma. Was it polyvinyl chloride? Was it arsenic? Then history क्या थी? If both were in option, history क्या थी? Was it farmer? Was it plastic industry? चलो सब बीसीसी की बात कर रहे हैं, तो आई हर्ड अ क्वेश्चन ऑन बीसीसी आया था और इमेज दे रखी थी एचपी इमेज, यस और नो। क्या नोडुलर पेलिसेडिंग की इमेज थी ऑन बीसीसी? बीसीसी पे दो क्वेश्चन आए थे, गॉट टू नो। लीजन नियर आइस, एंड बेसल सेल कार्सिनोमा की जो एचपी इमेज आई थी, देन बेंजीडीन। Was there HPE image of basal cell carcinoma or was it a clinical case? HPE इमेज थी, यस और नो? अच्छा सेमाइनोमा पे कोई इमेज थी? यार एक वेस्कुलाइटिस पे क्वेश्चन आता, कैन यू हेल्प मी विद आउट? वेस्कुलाइटिस पे क्वेश्चन था, 40 ईयर एज थी। वेस्कुलाइटिस पे क्या क्वेश्चन आया था? नो इमेज, फीचर्स पूछे थे ऑन द बेसिस ऑफ टॉक्सिसिटी। किसकी टॉक्सिसिटी थी? टाकायासु, ओके टाकायासु था। चल क्योंकि एज थी लेस देन 50, सो टाकायासु कंफर्म। कुछ हिस्ट्री याद है टाकायासु की? अच्छा लास्ट थिंग, इफ यू कैन हेल्प मी आउट विद दिस। ऑप्शन एज 40 ईयर्स था। One last question I want to know is, can you please help me out with nephrotic, nephritic पे 2-3 क्वेश्चन आए थे। नेफ्रोटिक और नेफ्राइटिक पे 2-3 क्वेश्चन थे। कैन यू रिकॉल थोड़ा सा नेफ्राइटिक और नेफ्रोटिक वाला क्वेश्चन? मेम्ब्रेनस ग्लोमेरुलोपैथी पे क्वेश्चन था क्या? Okay, Takayasu mein subclavian artery was mentioned. ओके डन, थैंक यू सो मच गाइस. वायर लूप लोशन पे कोई क्वेश्चन था? अच्छा, नेफ्रोटिक नेफ्राइटिक पे आई हर्ड देयर वर 3 क्वेश्चन. वीक पल्सेस, डन गाइस. नेफ्रोटिक नेफ्राइटिक पे जाइंट सेल आर्थराइटिस, जाइंट सेल आर्थराइटिस पे नहीं, टाकायासु पे था इमरान. सब बच्चों के हिसाब से लग रहा है यंग एज था, सबक्लिवियन आर्टरी था, तो वो होगा. ओके, 1 क्वेश्चन ऑन पोस्ट इन्फेक्शियस ग्लोमेरुलर नेफ्राइटिस, 1 क्वेश्चन ऑन PSGN. थैंक यू सो मच फॉर योर इनपुट गाइस. रेस WBC, हिस्ट्री ऑफ सोर थ्रोट, हिमैचुरिया. चलो डन है, डन है. एक बता दो, कोलन कैंसर की जीन थी KRAS ऑप्शन. ये तो हर कोई एग्री करेगा, KRAS पे आई थी, हमने AK53 पढ़ा हुआ है. कोलन कैंसर पे KRAS जीन वॉज इन्वॉल्व, यस और नो? कोलन कैंसर था, KRAS जीन पे क्वेश्चन आ रहा था, यस और नो? तो सब एग्री करेंगे, डन है. देन आई हर्ड एडल्ट विद हिमैचुरिया एंड मेसेंजर डिपॉजिट. माइक्रोवर्ल्ड ऑप्शन में क्या था? सारे ऑप्शन में थे, तो मोस्ट कॉमन इज KRAS. व्हाट एग्जैक्ट, क्योंकि ऑल 3 जीन्स यू टोल्ड, कोलोन कैंसर की जीन पूछी गई थी, KRAS भी, P53 भी, MMR, ऑल ऑफ देम कैन कॉज कोलोन कैंसर. तो व्हाट एग्जैक्टली वाज द क्वेश्चन? क्योंकि मोस्ट कॉमन जीन तो APC जीन है. गाइस आई नीड यू हेल्प. KRAS पे क्या क्वेश्चन आया था? Just KRAS familial female with abdominal pain, history of colon cancer. Chalo, I'll take it. So, BRAF was not the option, no? सीनू पैराथायरॉयड एडिनोमा पे क्वेश्चन आया था. पैराथायरॉयड एडिनोमा पे क्या क्वेश्चन था? एनीबॉडी रिमेंबर्स? क्वेश्चन ऑन पैराथायरॉयड एडिनोमा पे भी आया था. फटाफट बता दो, फिर हम बाय करेंगे दूसरे को. द टीचर्स आर वेटिंग. पैराथायरॉयड एडिनोमा पे एनी क्वेश्चन गाइस? इविंग सार्कोमा की ट्रांसलोकेशन 1122. बर्का was in the option. P53 was in the option. Palpitation spreading. Lung cancer पे क्वेश्चन था गाइस. Just to finish up, there was one question on lung cancer. There is one question on lung cancer. Can you recall and then we'll say bye to each other. Lung cancer पे क्या क्वेश्चन था? स्मॉल सेल पे था क्या स्क्वामस सेल पे? इतना बता दो, इफ यू कैन रिमेंबर दैट. स्मॉल सेल पे था या स्क्वामस पे? सब कह रहे हैं स्मॉल सेल पे था. क्लिनिकल हिस्ट्री थी या एचपी इमेज थी? जस्ट टेल मी दैट. दोनों पे था. बोथ. तो somebody is telling me कि बोथ है. सौरभ इज सेलिंग सर स्क्वामस सेल पे भी आया था, स्मॉल सेल. मतलब सिस्मिक पैथ तो भरी पड़ी थी, राइट? देयर वाज लॉट ऑफ सिस्मिक पैथ. एज यू आर टेलिंग मी. थायराइड कैंसर पे एक भी क्वेश्चन नहीं था क्या? हार्ड टू बिलीव. सीएनएस ट्यूमर पे एक भी क्वेश्चन नहीं था क्या? हार्ड टू बिलीव. दोनों क्लिनिकल हिस्ट्री. किसी में पिंक केराटिन पर्ल्स, किसका डायग्नोसिस था? डेली डैश. SIADH की हिस्ट्री थी. SIADH था, कुशिंग था. माइक्रो वर्ल्ड. सी द वे यू आर टेलिंग मी ऑल द जीन्स आर इन्वॉल्व इन कोलन कैंसर. All 4 genes are involved in colon cancer. You have to give me some specific history here. All of them are familial. Just rule mismatch repair genes because that is hereditary non-polyposis. Cigarette smoker 20 years. स्क्वेमस पे क्या था? स्क्वेमस सेल कार्सिनोमा पे. ऑस्मोलैरिटी डिक्रीज था. ओके, गॉट इट. एंड व्हाट अबाउट स्क्वेमस सेल कार्सिनोमा? उसकी भी क्लिनिकल हिस्ट्री थी स्क्वेमस सेल की. गॉट इट. थैंक यू सीनू. What about squamous cell carcinoma? Hypercalcemia था, pink keratin pulse था, PANCOS था. What made you go for squamous cell carcinoma in the exams? Just tell me that, guys, and then we'll end up the session. Thank you so much. I know बहुत difficult था. कुछ और याद आए तो please do let me know. That's my Instagram handle. That's my Telegram handle. कुछ क्वेश्चन याद आए प्लीज टू लेट मी नो. नेसोफ्रेंजियल पे भी था. ENT से आया था. प्रेजेंटेशन टाइप पूछा था. कौन सा कार्सिनोमा है, एडिनो या स्क्वेमस? नेसोफ्रेंजियल स्क्वेमस और एडिनो. विश्वजीत प्लीज थोड़ा सा बता दे मुझे. किसी कुछ याद आया तो प्लीज डू शेयर द इनपुट्स. EBV nasopharyngeal carcinoma. Hi Dr. Debaki, thank you buddy. चलो centrally located mass. Done है guys. चलो thank you so much guys. कुछ याद do let me know. I'm sorry to get time and thank you so much. इस इतने स्ट्रेस के बाद भी you were there to help us, help your juniors, especially I know आपके juniors की help करोगे because तुम्हारा तो निकल जाना है. All the wishes are for you guys. Thank you for helping me out. God bless you guys. God bless you. कुछ याद है to let me know guys.
Okay, so hello everyone. I hope I am audible and visible. Can I get a quick thumbs up from all of you? So am I audible and visible to everyone? Great. So good evening all of you, and so I hope you did your exam well. We got actually mixed opinion. कुछ बच्चे बोल रहे थे it was good ma'am, कुछ बच्चे बोल रहे थे ma'am it was little confusing. So I could find out some 7 to 8 questions in dermatology, but you have to tell me what are the details of the question, because I could just find out the topics. So great. Yes, Daily Dash, there was a question on scabies. I will come to that. So let us start with the first question. With what I got is, they told me that there was a question that there was a history that there was a patient with unprotected intercourse who presented with painless genital ulcer. Now, bacho, I am not sure whether they were asking you the question on the diagnosis, or whether there was the question on the treatment. Because painless genital ulcer with painless lymph node is a feature of syphilis. If they are asking you the diagnosis, it should be syphilis. And if they are asking you the treatment, it should be benzathine penicillin. So you have to tell me, bacho, what was the exact question related to STD. I told you in your before your exams also, during the DFX also, during the regular classes also, कि STD is a very important topic. The chances of getting one question from STD is very, very high, and that is what we have seen here. So can you tell me what was the options? Only this much was given, or was there any image attached to it? Because I think it's an easy question, and it's a PYQ also. We have discussed that painless genital ulcers were asked in the last year, I think last to last year exams also. टेस्टिस पर सिल्वर नोड्यूल्स थे, ऑप्शन सोराइसिस बी था. देखो माइक्रो वर्ल्ड, देयर वाज अनदर क्वेश्चन व्हिच वाज टोल्ड टू मी बाय द स्टूडेंट्स दैट देयर वाज अ क्वेश्चन वेयर ऑन द स्क्रोटम देयर वर सम नोड्यूल्स and there was a history of burrow given, and that is why we are considering that to be a syphilis question, a scabies question. In syphilis, there should be a painless genital ulcer. They should give you history of other lesions, which includes palm sole or the lesions of the genitalia, which are condyloma lata. They can give you generalized lymphadenopathy. They can give you history of the hair loss. So any such history was given. Syphilis ka causative agent was the option. So what is the causative agent of syphilis, bacho? If they are asking you the causative agent, it is Treponema pallidum. Treponema pallidum, which is a spirochete. If they are asking you the causative agent, it should be Treponema pallidum. Okay? Done. So I think this is an easy question, and I am sure you all must have answered this question. Painless ulcer was given, and there was a word matted. देखो matted word can be used for lymph node. Now lymph node should be painless for the syphilis, but if they have mentioned बच्चों painless ulcer and painful lymph nodes, then the answer changes, and that becomes LGV, and the organism becomes chlamydia. So you have to be sure what was given with respect to the lymph node, because if lymph nodes painless, only then syphilis becomes the diagnosis, because the painless ulcer is a feature of chlamydia or LGV also. Okay? Chalo. So I think everybody is saying that the lymph node were painless and the genital ulcer, then the answer should be Treponema pallidum. I think it's an easy one. Streptococcus, it should not be streptococcus. Streptococcus do not cause genital ulcers, so that should not be the answer. Now coming to the next question, bacho, I was told that there was a question on the paucibacillary leprosy. Now, was it a question where they're asking you the dosage, or was it a question where they have shown you the image? Because whether it is pauci or whether it is multi, the treatment remains same. We give the pink or maroon color kit for adult. We give a maroon color kit for adult, and if it is a child, we give a yellow or a orange color kit. So what was the question asked with respect to MDT? I think a cauliflower was a different question where they have mentioned something on the leg, and that was associated with cauliflower lesion. I think that was a different question, bacho. Okay. So they have not given any image. They have asked you what is the treatment of paucibacillary leprosy. Bacho, you know that in paucibacillary, the treatment is same. If it is an adult, we give 600 mg of rifampicin. once a month, and it should be supervised. Clofazimine is 300 mg, again once a month, supervised. And we also give 50 mg clofazimine daily, which is non-supervised. Patient take that dose at home. Then we have Depson 100 mg taken daily, non-supervised. देखो, the question is they are asking that MDT के साथ there was another thing. Was it a lepra reaction? Because if it is a lepra reaction, along with MDT, you have to add the patient on oral steroid. So what was the exact question given? That becomes important here. It's a very easy question. See, the same question got repeated last year also. So till now, the two questions which we got in dermatology, they were direct repeat, and we have discussed both of them in our classes also and DFX also. If there is leprosy, and along with that, if there is lepra reaction, you always continue giving MDT. You never stop giving MDT. So Nikita, if they're asking you whether you have to stop MDT, do not stop. Just add oral steroid along with that. Okay. So that was the second question. Okay. So I think this was the question which was given. If the new drug was mentioned, you have to tell me what was the new drug given and what was the description. Like, was it a patient of leprosy with HIV, or was it a patient with leprosy or some other chronic issue like leprosy with TB, leprosy with HIV, something like that. If they have given you something like that, then the other option becomes important. Acha, the other disease was not related to leprosy. Done. Okay. Now coming to the next question. Now in this question also, bacho, the question was there were nodular lesions on the scrotum and the penile shaft, and some students told me that they have mentioned something about the burrow. So anything like that was mentioned in the question? Was anything related to burrow mentioned in the question? Because here, if it is a nodular lesion, the location is the penile shaft and scrotum only. And if they have mentioned that presence of burrow, that's a very characteristic feature of scabies. Now, I would like to know that what are the options given? What were the options given here? मैम ऑप्शन में बरो था, क्वेश्चन में था क्राउडेड होम है, ठीक है. नाउ अगेन दैट इज अ वेरी फेवरेबल थिंग. इफ दे हैव गिवन क्राउडेड होम, you know that scabies has a nature that it presents in those individuals, those who have poor local hygiene, overcrowding, low socioeconomic status. Now if they're asking you what will you see other than the nodules, the answer definitely will have burrow. So that's a very classical description of scabies given in the question. Now they have also mentioned nocturnal itching, again in favor of scabies, and burrow should be seen. Okay, so I think this was an easy question. It's a very easy question. Nocturnal nodular lesions with nocturnal itching and crowded home, they are all favoring scabies. And if the option contain burrows, in burrows you will see burrows on the scrotum, in between the fingers, web spaces. So I think that's an easy question. Now this was another question which I got from students, and they have mentioned that the question was what test will you do prior to giving isotretinoin? Now, bachcho, some of the options were also given to me. Let me just open those options. Now, the options were number 1, renal function test, number 2, liver function test, number 3, insulin levels, and okay, only these 3 options I could find. Now, bachcho, remember, isotretinoin has a basic nature to alter liver function test. It has a basic nature to increase triglyceride levels. So whenever I have to start the patient on isotretinoin, I always do a baseline LFT. I always do a baseline lipid profile to look for the triglyceride levels. So if these are the options, I will definitely mark LFT as the answer. So bachcho, what was the options? The option number 4, I would like to know. What was the option number 4 given? What test will you do prior to starting isotretinoin? Okay, done. I have no idea about option number 4, but if these are the other options, then LFT and the lipid profile as we do. Clear hai? Acha, the 4th option given was electrolyte test. Face का image था. So there is an image given in this question where you can see pus filled lesions. Okay. So pus filled acne was given in the question and पूछा था कि isotretinoin देने से पहले क्या टेस्ट करोगे. So बच्चों, LFT should be the answer. Sodium and some electrolyte was given. We do not do that, but definitely LFT should be done. ठीक है? Chalo, so that was the 4th question. Coming to the 5th question, bachcho, there was an image given where you can see vesicles on hand, foot and mouth. I think this is again a very easy and frequently asked question. It is a Coxsackie A16 virus infection. It's a Coxsackie A16 virus infection, and bachcho, Coxsackie A16 causes hand, foot, mouth disease. अच्छा, अगर previous question में LFT plus CBC दे रखा है, that is also correct. LFT CBC you can do. LFT is main because we have seen alteration of LFT when you give isotretinoin. So even if CBC is given along with that, that becomes the correct option. And in this question, I think there's no confusion. It's a direct question where you have to mark HFMD, which is because of Coxsackie A16. Now, here is another question where they have given you that BCC presents near the medial canthus, a very small area, but still BCC is considered to be a high-grade cancer. Why? Now, bachcho, I could not find the options, but one of the students told me that there was an option which says that it's a locally aggressive tumor. It do not metastatize distally. And because it is locally aggressive, it will spread more. It will destroy the structures nearby. And that is why it is considered to be the high grade cancer. So you have to help me out with the options here. What was the option given? In the previous option, HbA1c was also given. HbA1c is also not altered by isotretinoin. अच्छा, एक option था that it can go to the eyes. What was the other option? It can go to the eyes. Okay. 3 is deep. देखो बच्चों, remember BCC do not metastatize distally. It do not metastatize distally. So any option which says that it is getting deep metastasis, that is not correct. It goes in the brain, not correct. Invasion in the brain, not correct, because Very rarely you will see distal metastasis. Anything else, Atul? Microworld, anything was given in this question? I think if it is written distally, that should not be correct. Anything which says that it is locally aggressive should be the correct answer for this question. Okay. So I think if you have to mark correct, according to me, this should be the better option, that it is locally aggressive. It can damage the structure which is local. It will never go distal to some places like brain or inner organs. So that should not be the correct answer. Okay. Now, bachcho, I think there was one more question where they have shown the image with NCOOP-D saber. Now, what is NCOOP-D saber, bachcho? That's morphia. I'm not exactly sure that that was the question or not. NCOOP-D saber. What is this, bachcho? There is a atrophic plaque on the forehead. There's a depression on the forehead, which is a type of morphia. And in morphia, if they are showing you biopsy, then it should be a box shape biopsy. Now, I don't know what was the question which was asked. One of the students is saying, ma'am, that there was an image of scalp and there was an option on the histopath. BCC and asked its toxic feature. Only ये पूछा था. Microworld ये ऑप्शन नहीं था. कौन सा वाला ऑप्शन नहीं था बीसीसी में? लाइक दे हैव नॉट गिवन एनी ऑप्शन विच इज सेइंग दैट इट इज लोकली एग्रेसिव, or there was no option saying that it is distally aggressive. देखो, you have to just remember one concept, that BCC can involve the surrounding tissue. It can damage whatever comes in the local neighborhood. It will never go somewhere distal. So going till the brain is very unlikely. If that is the option, that should not be a correct option. Now here it is an image based question. So there was an image of NCOOP-D saber which was given. And what else was given in this question? What was the histopath given? And what were the options, if you can recall something? Okay, so bachcho, this was the last question which I could find out. These were total 8 or 9 questions from dermatology. Any topic which we have missed, you have to tell me. Or if you can tell me what was the exact question with this morphia lesions and what was the exact options given for that BCC question. Because see, I don't know what are the other options, and that is why for us to come to an exact diagnosis or exact correct option is difficult. But I told you the concept. Remember that local aggressiveness is the feature, and that is why we treat locally. We do not give any injectables or any chemotherapy for the patients of BCC. For morphia, they can ask you the biopsy features, which is actually fibrin deposition. It's a feature of scleroderma. Acha, student are saying that one of the students told me that hair ka layer पूछा था. Hair layers they have asked. So बच्चों देखो, if you take a transverse section, the innermost layer is medulla. Outer to medulla we have cortex. Outer to cortex we have cuticle. Then outside cuticle we have inner root sheath. And outside inner root sheath we have dermal sheath. So any such option you can see with that hair wala question bachcho. And outside outer root sheath we have dermal sheath. So if they have given you the hair and they have asked you about these layer, that becomes a more logic question. हाँ, माइक्रोवर्ल्ड अगर आई के पास बीसीसी है, it can go into the orbit. If you have BCC very close to the eye, it can definitely go towards the eyes. it can damage, see ऐसा बोलते हैं कि it can actually damage the underneath bone. So if it is very close to the eye, first it will damage the orbit, it will start damaging the muscles of the eye, and if you are not treating, it can even go inside. So that can be possible. हेयर का हिस्टोपैथ था, ब्लीडिंग था एंड ABC पूछा था. देखो अगर ब्लीडिंग था देन इट कुड बी अ क्वेश्चन ऑफ यू कैन हैव अ क्वेश्चन ऑफ ट्राइकोटिलोमेनिया, बिकॉज अगर ब्लीडिंग हो रहा है तो ट्राइकोटिलोमेनिया हो सकता है. या फिर इफ दे हैव गिवन यू इमेज विच इज लाइक दिस, द लोअर पोर्शन ऑफ द हेयर इज शोन एंड यू हैव ब्लड वेसल्स विच इज हियर. हाँ, माइक्रोबल देखो अगर आई के पास है इट कैन गो इनसाइड द आई, बट वी शुड नो द अदर ऑप्शंस ऑल्सो टू बी 100% श्योर व्हाट वाज द एग्जैक्ट क्वेश्चन. ठीक है, सो आई थिंक बच्चों दिस वाज द लास्ट क्वेश्चन विच आई कुड गेट. सो वी आर टोटल 9 क्वेश्चंस which are directly from dermatology. But the first 7 questions were from the previous year topics only. The hair also we have discussed, but we are not very much sure what was the exact option. Scalp का label पूछा था, कहा था what is ABCD. Okay, again very difficult for me to answer it because we don't know exactly what was the option given. If you have any related image, you can share it on the Telegram or on the WhatsApp. I will go through that question. I'll try to find out myself also, and we will make a better recall. Obviously this was not a good recall, but at least the 9 questions which I got, I'll try to find out more in detail about those questions. So bachcho, I think with this we are done. I'm sure other teachers must be waiting. So all the best bachcho. अब exam हो गया, अब tension नहीं करनी, just relax. After the recall, enjoy at least 1 or 2 days. कुछ नहीं करना है, मस्ती करनी है, ठीक है. And if you get a question, you share it with me. ठीक है, चलो, bye bye and take care.
Please.
I have shared.
All right, sir. I'll check it. Good evening, doctors. I hope you could able to hear me well. Guys, if you could able to hear me well and you could able to see the screen, please do, let me know in the comment box. Guys, could you able to hear me? Doctors, I hope you could able to hear me well. So let's take up the questions. Before I move on, let me just express this point to you. I understand that the paper is tough and you guys had a lot of questions unexpected, a lot of patterns unexpected, but truth being told, this is exactly what life is, guys. Stay strong. Strength is the one thing that is going to save us in every kind of adversaries in life. Be strong, be temperamentally rigid, and be rock solid. Whatever the kind of difficulty that life throws at us, we're going to face it up, right people? So strength and honor, guys. So let's take up the very first question here, and please do correct me if there are any mistakes, and if you could able to remember the questions, again please do let me know. I'll make a mark of it, and then once we go on for the main discussion, I'll take up each and every question, guys. And the first question I've received is Chopstick sign. I'm pretty sure that this is more of a image based discussion. So the image was given, it's like this, right? The image was given like this, tapping the cheek of the patient, and or sometimes mandible ramus can be tapped. If there happens to be a hypocalcemia, there is going to be increased excitability of neurons, and clearly Chopstick sign is the best answer. It is going to be connected with hypocalcemia. If the question was asking about what will happen to the neurons or muscle cell, the answer is going to be increase in excitability. So this is going to be question number 1, guys, right? I'm sure most of you would have got this question fairly right and straight, and this is going to take us to the second question. The second question is all about a pressure volume loop, isn't it? So if it happens to be pressure volume loop, and exactly this segment was the question here, from the point of opening of aortic valve to the point of closure of aortic valve, this segment was asked, and clearly the answer is going to be ejection. Guys, the phase highlighted by the left ventricular pressure volume loop as asked in the question is going to be ejection phase, and that's going to be second question. I'm sure you got the second question right as well. And this is going to take us to the third question. The third question was about creatinine clearance versus inulin clearance. I couldn't able to exactly get the right question, but if the question is about which is the best dye you can use to assess glomerular filtration rate, the gold standard dye, if the question is about gold standard dye, definitely you should have gone for inulin clearance. Or if the question is directly about creatinine clearance and you are supposed to identify the pitfall with creatinine clearance, definitely this is going to be the answer. Overestimation of GFR is the right answer if the question was specifically asking about creatinine clearance. Right, doctors? And the reason why creatinine clearance overestimate GFR is because creatinine is going to be filtered as well as it is going to get secreted, guys. So that's the reason why we find the value overestimating if we use creatinine to assess glomerular filtration rate. And that is going to take us to the fourth question. The fourth question is all about type of glucose transporters. Doctors, I'm not very sure whether the question is about blood-brain barrier or the question is about brain or neuron in specific manner. Whatever it is, let me share the answers to you. It will be easy for you to process. Now, if the question is about neurons, the glucose transporters present in neurons, you should have picked GLUT transporter 1 or GLUT transporter 3 if the question is about neurons. If the question is specifically about blood-brain barrier, which is essentially made of astrocytes, now again the answer comes to GLUT1 because astrocytes do have GLUT1 type of glucose transporters. If in case the question was asking about microglia and another glial cell in the brain, if the question was about microglia, definitely the answer is going to be GLUT5, right? And if the question happens to be choroid plexus, there are no GLUT transporters in choroid plexus, you should have gone for SGLT type 1, right? Dr. Faisal, for brain, specifically brain. Good. Faisal, if the question is about brain, you should have gone for GLUT1, which is going to be the best answer, followed by GLUT3. Because not every neuron expresses GLUT3, but almost every neuron is going to be expressing GLUT1. So if the question is about brain, the best answer for that question happens to be GLUT1, doctors. All right. So that's going to be question number 4. And coming to question number 5, guys, again, I'm not very sure what the question is exactly all about. Is it about, the presentation of the patient, or is it about the pathophysiology in atonic bladder, or is it about the conditions that causes or that gives rise to atonic bladder? Now, if you could able to recall and if that memory is still vivid in your brain, please do let me know in the comments. And Faisal, option was like GLUT. Yeah, of course, GLUT1 was the right answer for the past question. Now for this question, if the question happens to be atonic bladder, these are the findings. There must be number 1, a drop in bladder tone. Number 2, it will also be called as flaccid bladder. The third word will be, it is going to be element bladder, also called as lower motor neuron type of bladder. And question number 4, it's going to be overflow incontinence. The classic presenting finding in atonic bladder is going to be overflow incontinence. And the next set, if it is all about the pathophysiology, what could have happened so that the patient would have been presenting with atonic bladder, there will be damage to both afferents as well as efferents. The nerves coming from the spinal cord to the bladder detrusor, or the nerves starting from the bladder going to the spinal cord, there will be a combined damage to both afferent and efferent. Depending on the question, you can able to pick the answer, guys. If the question is all about conditions, the most best answer you should be thinking of is going to be tabes dorsalis. Usually, this is the option that they have been asked in the past for very long period of time. If the question is not mentioning tabes dorsalis, you should have gone for severe vitamin B12 deficiency that could have been causing subacute combined cord degeneration, or diabetic neuropathy in severe cases, or any posterior segment of spinal cord pathophysiology will be leading to atonic bladder. So these are the choices when it comes to atonic bladder. And Dr. Maruf Sensari, and atonic bladder graph was there, right? If this happens to be a graph, in atonic bladder, the graph would have been made somewhat like this. So we will be having pressure on the y-axis, and there will be volume on the x-axis. Since the bladder is unable to contract, the bladder volume will be rising. As the volume will be rising, there is going to be a minimal rise in pressure, and the pressure will stay very low, close to x-axis. There will not be having any sort of micturition contractions. Usually there will be micturition contraction if this happens to be a normal bladder. If it is an atonic bladder, there will be no micturition contraction. So that is going to be a classic finding in atonic bladder. Dr. Maruf Ansari, if this happens to be the graph they were asking, so clearly it's going to be an atonic bladder, guys. Good. And that's going to be question number 5. And question number 6. Doctors, this, frankly speaking, these were all the questions that my students told me very precisely with their memory sharp. And other possible questions, they couldn't able to recall. If you could able to contribute to these questions, it would be really great. I'll be grateful to you guys. And question number 6 is all about opening snap. Opening snap is a hard sound that is going to be associated with mitral stenosis. Clearly, classic finding. If it is opening snap, it is mitral stenosis. And then there was a question about equilibrium. Guys, could you able to contribute this question? What was the question they were asking about equilibrium, doctors? And these were the questions I really couldn't able to figure out. Students couldn't able to recall. It's obvious, the stress, the emotions would be running high. So it's all right. Even if you couldn't able to recall now, in case if you could able to get that memory a few hours later, a day later, please do send those questions. It will be helpful to figure out how they are thinking and how we have to move forward, right, doctors? So there was a question about equilibrium. If you could able to contribute, well and good. There was a question about semi-permeable membrane. Again, I couldn't able to figure out what exactly the question is. I'm expecting your contribution there as well. And of course, there was a question about bladder pressure volume loop. This is, I think, Dr. Ansari was saying. So if this happens to be a normal pressure volume loop of the bladder, there is going to be micturition contraction waves like this. With every contraction of bladder, the pressure rises. With bladder relaxation, the pressure falls. The pressure rises, and with bladder relaxation, the pressure falls. But if this happens to be an atonic bladder, there cannot be any micturition contraction. There cannot be any rise in this phase as well. So we are not going to see this phase if this happens to be atonic bladder. So these were the questions that I could able to figure out. Yeah, of course, finally, the last one question, guys. The type of bariatric surgery, I'm not sure whether the question was using the word bariatric surgery or the question was using the word gastric bypass surgery. But end of the day, the question is this. In which kind of the surgery there is going to be a profound drop in vitamin B12, right? And the best answer for the question is going to be Roux-en-Y gastric bypass. This is the kind of surgery where majority of stomach content is going to be bypassed, and without any trigger, there is not going to be any production of intrinsic factor of Castle. Without that, there is not going to be any B12 absorption. So Roux-en-Y gastric bypass is the best answer. Now, if the question was asking you to organize the surgeries in the order of importance, the first and the best answer is going to be Roux-en-Y gastric bypass, and the second best answer is going to be biliopancreatic diversion with duodenal switch. This is going to be the second surgery which will cause B12 deficiency next to Roux-en-Y gastric bypass. And third and fourth is sort of a debate. When it comes to vertical sleeve gastrectomy as well as adjustable gastric band, we are not very sure which one comes first in order, or do they have equal amount of contribution when it comes to B12 deficiency. This is sort of a controversial topic. Some books speaks about vertical sleeve gastrectomy. Some books speaks both VSG as well as AGB has got equal tendency to cause B12 deficiency, guys. So these were the questions. Both options were there, options Roux-en-Y and BPDDS. Yeah, if both options were there, then clearly Roux-en-Y happens to be the best answer, doctors. So this completes the discussion. And doctors, as I was telling you, if you could able to contribute any more questions, that will be helpful for our future discussion, and we can track where the pattern is going on, guys. Apart from that, before I close, I just want you to tell you just one more point. For most of you, it would have been a very tough day, a challenge thrown at you. This has practically tested your strength. This has practically tested your faith, your hope, your confidence, everything. Guys, anything can happen in the external circumstances to us, but the inner core and the inner self, the strength and the temperament that you have to maintain has to be top notch no matter what the outer circumstances, right? Please remember, strength prevails and strength alone prevails. Doctors, I wish you all the best. May God bless you all. I'll pray for you. You'll be in my prayers. My best wishes, guys, and we'll be in touch. Let's discuss the questions in the future as well. Now, thank you very much, guys. I'll open the session for the next faculty.
Hello, hello, hello. All right, so hi everyone, this is Dr. Kashish Grover, your PSM faculty at DAMS, and so finally the exam day happened, right? And so many days, so many notes, so many, MCQs, and finally the day happened, right? So without delay, let us start, guys. Please, please just write hi, hello in the chat box so that I know how many are there. And without any delay, let's discuss PSM. Without any delay, let's discuss PSM. Right. I still remember your last FMG exam. PSM was a little bit, out of the league, and many questions, 2-3 questions were from the guidelines, and students, they got disheartened. I told you in the class that point number 1, majority of the things will be from your notes. Yes, they are. Point number 2, I told you that this time they will not ask that what is the name of mother of Ashok. So they will not ask what is the name of mother of Ashok. They will ask what is the name of wife of Ashok's father. So this thing I told you in class, that they will not ask you directly questions, but they will ask you questions indirectly to test your patience more than your knowledge about the subject, right? So guys, without any delay, let's start the questions. So what I have is few topics, few questions, right? Because in such a short time we only have 1 or 2 keywords for the question, right? So I will be coming again tomorrow, maybe day after tomorrow, with all the questions, right? So it is just a discussion of the paper. How was the paper? So those who are listening me, please write in the comment box how was the paper, how was the PSM specifically in the paper, and how you felt it, right? What I feel is paper was good. PSM, I'm talking about PSM. What I feel is PSM was good, except one question, to be very honest, that pension yojana. Were around a good amount of questions from PSM, right? Let us discuss without any delay. Let us discuss without any delay the topic. Let us discuss without any delay the questions. So this question was there in the form of a video. This question was there in form of a video where they showed the questions. This question was there in the form of video where they show images and they ask you the logo belongs to what. So this logo was there. This belongs to WHO. This belongs to UNICEF. Yes, overall paper was pretty tough. Yes, you can say there were many questions. Integrated questions were more there, but yes, those who have read, those who have base, those students, they told me that paper was doable as well, right? Okay, So this is a program NLEP, and this is ICDS. This is ICDS. So this question was there, right? So can you please write exactly what was, exactly what was there? Okay. Many students told me that this image was there. This image was there where they mentioned specifically cases and controls, disease and disease free, disease and disease free. So this question was there. So if this image was there, okay, so Dr. Maruf is telling that there was a sequence. Okay, so they were asking about the sequence of images, sequence of images. Okay, yes, we all are tired, we all want to have some, relaxed time. So let us quickly discuss the paper, and we will have an idea. So if I talk about this question, so image was there, this image was there, and they asked what is case control, right? So the correct answer was case control. The correct answer was case control. Now, many students, they are confused between retrospective as well. They are confused between retrospective as well. Retrospective cohort. Please listen to me. Please listen to me very carefully. It is retrospective or it is case control. It only depends from where the study was started. If the question started from diseased and disease free, and they are checking the exposure, then it becomes case control. If the question starts from exposed in the past to sick presently, this became the retrospective, right? This became the retrospective, right? This became the retrospective. Now, what do you think? What was there? Was it starting from exposed or was it starting from diseased? Was it starting from exposed or was it starting from diseased? Exposed in the past, Dr. Maruf. Okay, Dr. Arun is saying disease se start tha. Dr. Maruf is saying totally opposite thing. So again, this is how the recall error, right? This is how. Okay, I will wait for other students as well before going to the, but the gist I have told you why the answer will be case control, why the answer will be retrospective. If it was starting from disease, then certainly the answer should be case control. The answer should be case control. All right. Can I go ahead, everyone? Now, coming to the next question. Many students, they told me, sir, there was a history of dog bite where the dog is vaccinated. Where the dog is vaccinated. Guys, this we have already done in the class, that if the dog is vaccinated, it doesn't matter. In India, we do not consider whether the dog is vaccinated or not. Even if the dog is vaccinated, we treat it as a fresh case unvaccinated. We treat it as a fresh case unvaccinated dog, right? And because the bleeding is present here, so this becomes category 3. Dr. Sudhanshu is also telling history of back record. Guys, if there was a history of back record, Okay, don't worry. I will work up more on this question, and we will definitely. So this is just a discussion part. I will be back tomorrow with the correct options. Option में case control, cross sectional, retrospective, cohort. Okay. Okay. Dr. Maruf is telling there was a finger with bleeding, and it was mentioned. It was mentioned that the dog is vaccinated. Then it becomes a category 3. In category 3, we give vaccine, we give immunoglobulin. So what was the option? Did you mark the correct? Dr. Faisal, if it is effect to cause, then again the answer is case control. Again the answer is case control. Now dog bite, bleeding is there, dog is vaccinated. What is the answer? Okay, let's discuss this question now. Category 3, yes, this becomes a category 3 bite, immunoglobulin and vaccine. Good. Okay, Dr. Faisal. So this question is set now. There was a finger with bleeding, dog bite, dog is vaccinated. What will we do? So we will treat it as a fresh case of category 3. And here we give vaccine plus immunoglobulin. Okay. So this we have already done. And this is a PYQ as well. Similar topic was there previously. Thank you so much, beta. Thank you so much. This time PSM was good. No doubt this time PSM was good. Right? Okay. So can we now go to next question? Okay. One question which was pain point for everybody. I was teaching Pradhan Mantri Melody Yojana, but here came some other Yojana, right? We were focusing on Pradhan Mantri Melody Yojana, but there was another question. PSM is life saving. Thank you, Dr. Arun. Thank you, Dr. Faisal. Now, name of the scheme: pension to give above 65-year-old and coming below poverty line. So this was a new question for you people. Guys, please listen. There are two keywords. Point number 1 is BPL, below poverty line. Point number 2 here is to 65 year. Guys, please listen. This Atal Pension Yojana is not the correct answer. In Atal Pension Yojana, it is like we give some amount every month, and after the retirement, it becomes our pension. But in Indira Gandhi pension scheme, this is given for all the below poverty line people who are more than 60 year, right? More than 60 year. So this was the question. Again, this is the question where I was talking about. They will not ask directly the name of, what is the name of Ajay's mother. They will ask what is the name of wife of Ajay's father. So indirect question. They are not asking you directly. Why indirect? Because guys, listen here. ESI, this question is from ESI, right? ESI is applicable to people who are earning less than 21,000, right? So here was the keyword that the question is from ESI, right? ESI. Yes, Sudhanshu, very good. Yes, correct answer is Indira Gandhi pension. Okay, now let's back to this question. Guys, इस क्वेश्चन पे आते हैं, ठीक है? 21,000 से कम एक women कमा रही है and she went tubectomy. Remember? Okay, चलो ये बताओ निमोनिक क्या था? निमोनिक याद है? 70, 80, 90, 100, राइट। 100% किस केस में होगा? दो ही केस में होगा। डू यू रिमेंबर? मैटरनल, राइट, मैटरनल, ओके, नॉट मैटरनल, प्रेगनेंसी से रिलेटेड, और दूसरा मैंने बताया था स्टरलाइजेशन। प्रेगनेंसी में 100% मिलेगा कितने हफ्ते? 26 हफ्ते। स्टरलाइजेशन अगर मेल कराता है तो 7 डेज, अगर फीमेल कराती है 14 डेज। ओके ओके डॉक्टर फैजल, 28 days. Thank you for correcting. This is what the students they told me in my DM, right? So what did you mark, guys? So here the correct answer was 14 days. One more question was from there. MTP Act. MTP Act is a PSM OVG by overlap. There are many times PSM guidelines are not that reliable. So MTP, please, this question was from OBG, right? This question was from OBG, right? This question is a ESI question. Done? Now, coming to next part. Again, this is a OBG and PSM integrated question. 18-year-old girl. So was it 8-year or 18-year or 10-year or 11-year or 17-year? Many versions are there. Many versions. What was the age? What was the age mentioned here? Because if 8-year was mentioned, then this also is a part of pediatric question also. This is also part of pedia. This becomes a pedia question as well. चलो जल्दी बताओ फटाफट. Okay, guys, quickly. Yes, everyone, quickly. 8-year-old girl, HB is low. What is the dose of HB? See, guys, what I want to tell you is that this is a case of anemia because HB is low. So this becomes the case of anemia. What will be the dose of iron folic acid? What will be the dose of iron folic acid? Okay, listen. What the students told me, okay, if Dr. Arun, if it is 12, then it changes the answer. For 12-year-old, 60 mg iron and 500 microgram folic acid twice a day. Twice a day. Okay. Right? Okay. 10, 12 to 14, no matter. 10 to 19 year. For 10 to 19 year, this is the dose. If they say prophylactically, right? If anemia is not present, the girl is absolutely fine. The girl is absolutely fine. Then it becomes once a day. So students told me that, sir, anemia was definitely there. Students told me, sir, anemia was definitely there. Then it becomes, the correct answer becomes twice a day. The correct answer becomes twice a day. Sorted? Okay, Dr. Farheen. Dr. Farheen is telling that HB was given 8.5. HB was given 8.5. Fine. Good. Coming to next question. Best economic water cleaning method for 20-liter water in a domestic household after disaster. Chlorine, alum, fluorine. Guys, listen. For 20-liter of water, or you can say 1 bucket water, see, the best method anyway for the domestic household is chlorination. How? For 20-liter or 1 bucket, 1 tablet of chlorine is enough. Whenever the disaster happens, we give chlorine tablets to the household and ask them to keep one tablet in one bucket, right? So this is the rough calculation because they cannot calculate how much they need to add. The correct answer becomes chlorine. Okay, so one student is telling about sand filter. No, then again also this will be not be the answer. The correct answer here will be chlorine. Dr. Maruf, sand filtration will not be the correct answer for household in the time of disaster. So this is the practical thing. Whenever there is a flood, also we give the families in those areas chlorine tablets, and we ask them in one bucket add one tablet. I'm 100% sure that the answer is chlorine, right? Dr. Hitesh is saying yes. Dr. Hitesh, yes, Dr. Hitesh, because the answer here mentions that she is having 8.5 HB, that is why the answer will be 60 mg iron, 500 microgram folic acid BD. 500 microgram folic acid BD. Guys, what was the question on this? Many students, they told that, sir, there was a question on proportional mortality rate, there was a question on crude death rate. My first question is, were these two different questions, or students are confusing it as two questions? So what was this proportional mortality rate, crude death rate? Moderate anemia was mentioned. Then again, for mild to moderate, this is the guideline. We give twice the tablet. Done, Dr. Farheen, I got your point. Okay, Dr. Arun is telling that we had two different questions. Okay, so one question was on proportional mortality rate of TB. So if you remember the same question, proportional mortality rate of TB, we have practiced in our face-to-face class, in our main class, and this is there in your workbook as well. So can you please tell me what was the values mentioned? सर ऐसी वैल्यूज थी, याद भी नहीं है, याद होनी भी नहीं चाहिए यार, तो कौन एग्जाम के बाद याद रखेगा, है ना? ठीक बात है, बिल्कुल ठीक बात है. Okay, what about other person? Can you please tell me? Okay, anyone who can tell me the values? Anyone who can recall the values? Okay, एक prevalence पे question भी था. Okay, so one question was on prevalence, one question was on positive predictive value, 0.5 for 1000 था आंसर. Tuberculosis 2021, 18 and till 21 December 8. All right. So proportional mortality rate. So one question was on proportional mortality rate. What is the formula for proportional mortality rate? Number of deaths divided by total deaths into 100. And one question was on prevalence, on calculating prevalence. And one question was on maternal mortality rate. भाई प्रेवलेंस वाले में 8 था या 7.4 समथिंग, किसी को याद है? And okay, guys, what was one MCQ on MMR? And one was on positive predictive value. So total 5 calculations were there. Now, what was this? Burden of disease. Guys, burden of disease. Burden of disease is calculated by DALI. Burden of disease is calculated by DALI. Burden of disease is calculated by DALI. Now, coming to the next question. Possibacillary MDT for leprosy. Possibacillary MDT for leprosy. Leprosy treatment was there. Leprosy treatment was there. Yes, DALI. Burden of disease, DALI. 100% sure the answer will be DALI. Good, Dr. Ajay, good. So if they ask MDT for treatment for leprosy, you remember we have already discussed this: dapsone, rifampicin, clofazimine. This blister is given for 6 months. This is a red color. Red color pack is there. This is used for 6 months. Guys, one student told me there is a question: shipyard worker was there with chronic cough. Shipyard worker, classically asbestosis. Classically, the answer is asbestosis. There is no doubt in that. Shipyard worker, asbestosis. And asbestosis, most common cancer is lung cancer, and most specific cancer is mesothelioma. So, very high yielding topic. In shipyard worker, asbestosis. So one question was there: sensitivity is given 80%, specificity 90%, prevalence is given 10%. Then we have to calculate positive predictive value. We have to calculate positive predictive value, guys. This we have also read. If sensitivity is given 80% and prevalence is given 10%, let us assume total population is 1000. So 100 are D plus, 900 are D minus. Now, sensitivity is given 80%. That means sensitivity is equal to true positive divided by true positive plus false negative. Right? Now, out of this is given 80%. So, true positive divided by true positive plus false negative is 100. It is 100. Right? So, now here the answer will be 80. So it becomes 80. So it becomes 20. Now next part is how many, what is the specificity given? True negative divided by true negative plus false positive. What is the true negative? True negative plus false positive is already given 900. Sensitivity is given 90. Okay, sensitivity is given 90%. Right? So here it becomes 810 and it becomes 90. And it becomes 90. So this is how we calculate positive predictive value 80 divided by 80 plus 90. This is how we calculate this question. Now, unvaccinated mother came for antenatal checkup. What vaccine we give her? Guys, we give TD. What vaccine is given to the mother who was never vaccinated? Right, we give TD. TD is the answer here. Right, what is the correct answer here? TD. What is the correct answer here? TD. Guys, this question we have already discussed in the class. An infant with anemia and wrist drop. Do you remember the mnemonic? A, B, C, D, E, F. Do you remember? B stands for basophilic stippling, which was shown here, right? And the correct answer becomes here lead poisoning. The correct answer becomes here lead poisoning. Okay, Dr. Hitesh, 26 week. What was 26 week? Here it was 26 week. Dr. Hitesh, here it was 26 weeks. Now, a mid-aged man previously worked in dye factory having bladder cancer. What is the probable cause of his condition? Dye factory and vinyl chloride, asbestos dust, silica dust, benzidine. Guys, with this 100% it is benzidine. Benzidine causes bladder cancer. Asbestos causes lung cancer and mesothelioma. This I have discussed. This I have discussed in detail. This I have already discussed in detail. All right. So these were the questions. Now, any point from your side, you are most welcome. I will be back tomorrow on this channel, DAMS Delhi YouTube channel, and I will be with the questions exactly. So, meanwhile, if you have any doubt, if you have any other input from your side regarding the PSM in the exam, kindly write in the chat box. Please write in the chat box. I am waiting for your reply. Postmenopausal women present when completing a required episode of body heat, flushing, sweating. The vasomotor symptom is deficiency. One question from, I think, Dr. Moonbridge TV, OBGY question. This is OBGY question. One question from committee. Yes, what was that? One question from committee. One question was from committee. I think the answer was Board committee. What the students told me regarding Board committee. I think it was regarding the primary care, primary health center. Yes, Dr. Arun. Sir, एक question था 6 week के vaccination पर भी था. Okay, was it like 6 week vaccination? What was that, Dr. Arun? 6 week vaccination. 6 week vaccination. Was there anything? First communication. Okay, so 6 week vaccination. If they have asked which vaccines are given, then we know ORIP, Penta, OPV, Rota, IPV, PCV. If they have asked about the side effect, so rotavirus causes intussusception, penta causes pain and fever. Pain and fever, right? Pain and fever. Was it like that? Pain and fever after the vaccine given at 6 weeks? Or did they ask which vaccines were given 6 weeks? Okay, don't worry, guys. I will be back tomorrow. And we will have a discussion. Right. I think enough for today. All right. No more doubts, no more questions, guys. Thank you so much. I wish you all a very good luck for your result. Now be calm, right? Be calm. Don't think again and again about the exam. Don't think again and about your preparation. Don't doubt yourself again and again. Don't, just don't think about it. It's gone now, right? One thing is there, it went well or it didn't went well. You just cannot go in the past. Now it's gone. Relax. This is the time where you should be most relaxed. If you know if the result is clear, then again you have to enter in a new hustle of your NEET PG internship, right? So this is the time where I think you should have a complete calmness. You should enjoy, right? Most importantly, you should do the things which you used to think during the प्रिपरेशन करते समय जो जो सोचते थे ना एग्जाम हो जाएगा वो करेंगे, अब वो टाइम है करने का, ठीक है? अब ज्यादा मत सोचो, राइट? बी काम. गॉड ब्लेस यू. थैंक यू सो मच. बाय.
You can add on to those questions in the page, and we can have a more detailed discussion based upon your documents and feedback. Am I audible? If the voice clear, you can send the chat on our channel. Okay, so one of the questions was on those transporters. Initially, the students gave a different question, but we don't follow different type of same. So I think the question which is there is decreased glucose in the CSF, but normal glucose is there in the blood. Please let me know if this is correct. Then we can discuss the options. Alright. Okay. So if the question was like this, please just keep discussing in the chat so that I know you are able to see and hear the things. Is the voice better now? Is the voice better now? IT, please check. Mic check, mic check. Is it better now? Mic check, can you hear me? Mic check. Is it better now? I'm waiting for the go ahead from the IT team before I can start. Please let me know if the voice is better. making some adjustment. Let's wait for them to give me the word before I can start. Yes, there is complete silence because IT team is doing some changes at my system. So until this, is it better now? Is it better now? Can you hear me? Can you hear me? Am I audible now? Are you able to hear me? Now it's okay. Great, great. Thank you for the heads up. Thank you for the heads up. So as I could get, please keep commenting on the statement of the question, on the options that were there, so that we are discussing the correct question. So as far as I could get from you, the question mentioned that the blood glucose level is normal. However, there is decreased glucose in the CSF. Is this the statement of the question? The blood glucose level is normal. However, the glucose in the CSF is decreased. Low glucose in the CSF. And your options are the different blood transporters. Is this the question? And if this is the statement, then your answer would be GLUT1. GLUT1 is the transporter on blood-brain barrier. GLUT1 is the transporter on the blood-brain barrier. See, every time they try to throw up the new locations for the different transporters. So please remember, GLUT1 is the transporter on the blood-brain barrier, and if GLUT1 is decreased in amount, then the blood glucose will be normal, but the CSF glucose will be decreased, as well as the entry of glucose in certain places where GLUT1 is the only transporter will also be affected. So if this is the statement, then your answer should be GLUT1. Please let me know if you're on the right track. Okay. I got the feedback from some students that biochemistry today was slightly tough because the questions that were presented in a difficult manner. You had long statement of the questions and too many possibilities based on the statements. So it was a little bit difficult to shortlist the answers this time. But the topics which were covered were some of the common topics that we regularly discuss. Okay. Another question where we had a long clinical case. Some of the features which were available in the question included the perifollicular hemorrhage, the bleeding gums, recurrent bruising, the poor wound healing, falls through hair. Were these features mentioned in the clinical case? Also, some students said, sir, there was a mention of the X-ray image where dense white line and metaphyseal seen was also mentioned in the question. And a second component was decreased activity of enzymes like lysyl hydroxylase and the proline hydroxylase for the synthesis of collagen. Are we on the right track? Can you let me know if this question was there? Yes. So if it mentions the perifollicular hemorrhage, bleeding gums, and decreased activity of the enzymes lysyl and prolyl hydroxylase for collagen synthesis, then obviously your answer is going to be vitamin C. Okay, your answer is going to be vitamin C. However, if perifollicular hemorrhage, bleeding gums, lysyl hydroxylase, these are not there, just it talks about bleeding. In that case, we have to look at vitamin K. You know, vitamin K is the activator of factor 2, 7, 9, and 10. Okay, so if the question talks only about bleeding, in that case, we go with vitamin K. But if other features are there which indicate scurvy,
Then obviously we are looking at vitamin C as the important cause for the clinical condition. This question, there was a lot of confusion from the different students. Some students said, sir, Crigler-Najjar was given. Some students said Crigler-Najjar syndrome 1 was given. Some students said, sir, Gilbert's option was there. Some students said, sir, this option was not there. So a lot of ambiguity in this question. So as far as I could compile, the question says, adult male, mild icterus, increased unconjugated bilirubin. Okay, please let me know if this comment on hepatosplenomegaly was included in the option or not. Okay, even if zinc was there in the option, if it mentions the activity of lysyl hydroxylase, prolyl hydroxylase, we are still dealing with vitamin C, which is the coenzyme for these two hydroxylases. Okay, so we are still dealing with scurvy. Okay, so adult male, mild icterus, increased unconjugated bilirubin, additional clinical features. Please let me know if the comment on hepatosplenomegaly was there or not. And the different conditions which are mentioned are related to the hyperbilirubinemia, the Dubin-Johnson syndrome, the Rotor syndrome, Crigler-Najjar syndrome type 1, and the Gilbert syndrome. Now here what you have to remember that Dubin-Johnson and Rotors are related to elevated conjugated bilirubin. They are inherited cause for elevated conjugated bilirubin. The Crigler-Najjar syndrome type 1 and type 2 along with Gilbert's are related to unconjugated bilirubin, elevated unconjugated bilirubin. So these are the conditions and the associated findings. Now, if it says mild icterus, if the question says mild icterus, in that case you have to remember that Crigler-Najjar syndrome is out, type 1 particularly, because among all the 4 inherited conditions, the most severe hyperbilirubinemia will be seen in Crigler-Najjar syndrome type 1, because here the conjugating enzyme has less than 5% activity and very high elevated level of bilirubin will be seen. So high bilirubin level, predominant icterus, that will be seen in Crigler-Najjar syndrome type 1. If it says mild icterus, then Crigler-Najjar syndrome type 1 is out. Okay, and because it mentions the unconjugated bilirubin, the Dubin-Johnson and Rotor syndrome are also out. In that case, you are left only with the Gilbert syndrome. Please remember, Gilbert syndrome has very mild icterus, which has the elevated unconjugated bilirubin. Conjugated bilirubin, Dubin-Johnson and Rotor. Okay, Dubin-Johnson and Rotor. If you're talking about the non-inherited conditions, then it will be obstructive jaundice, the CVD obstruction due to stone, or their worm infestation, or the carcinoma of pancreas, which are causing the obstructive jaundice. In these cases, you will have the elevated conjugated bilirubin. Unconjugated bilirubin, either due to Crigler-Najjar syndrome type 1, type 2, Gilbert's, or hemolytic anemias, where there is hemolysis, so that the excess bilirubin is being formed, which cannot be conjugated. Okay, so here most likely the answer is going to be Gilbert's, if this is the correct statement. Okay, so you have to let me know if we are on the right track or not. Now, some students said, sir, this question was there. Some students said, sir, this question was not there. So those students who said, sir, the question was there, based on their recall, they said one person is getting exposed to sunlight which contains the UV rays, and because of that some damage to the DNA is there. Which repair mechanism is going to rectify the damage due to this exposure? Okay, so you know that the UV damage is commonly causing the formation of the thymidine dimers. Sometimes in the question, instead of thymidine, it can be written as pyrimidine dimers, and we have done this in our rapid recall also, that thymidine dimers or pyrimidine dimers are repaired by the nucleotide excision repair. They are repaired by the nucleotide excision repair. Multiple nucleotides, one segment is removed at one go, and the gap filling is done with the help of the complementary DNA strand. Okay, so the removal of thymidine or pyrimidine dimers is done by the nucleotide excision repair. Okay, nucleotide excision repair will be the repair mechanism which will work here. Then there was one question on evaluation of kidney function talking about the clearance. Okay, and they had said that the clinician has recommended the creatinine clearance instead of the renal clearance. In comparison to renal clearance, creatinine clearance will give the representation of GFR as whether it will be equal, whether it will be slightly lower. This is in comparison to insulin clearance, which is the ideal substance formation clearance, or it will be slightly higher. So you have to remember, when you are using the creatinine for measuring the clearance, which is a measure of GFR, the creatinine is secreted. We had discussed this when we were doing the revision program also, that the creatinine is secreted and therefore it overestimates the GFR. So your answer for creatinine clearance will be, the values will be slightly higher than what you get from inulin clearance. Okay, values will be slightly higher than what you get from the inulin clearance. So please make note of that. Okay, there's one question related to which vitamin deficiency will be there in cystic fibrosis. For cystic fibrosis, you have to note that there will be decreased pancreatic. Okay. It was said that the creatinine is good but not best as per inulin, because so again it will be same thing, that creatinine is secreted and therefore it overestimates the GFR in comparison to inulin. So its value will be slightly higher than what is the correct GFR, or its value will be slightly higher than the inulin clearance. Thank you, Dr. Rahman, for your comment. So the answer remains the same, that slightly higher than inulin clearance or slightly higher than the actual GFR. Now, coming to cystic fibrosis, there is decreased pancreatic secretion, and because there is decreased pancreatic secretion, there will be decreased emulsification of fat. What is the result? The result is decreased lipid soluble vitamin absorption. So in cystic fibrosis, the lipid soluble vitamins are less in amount. So among the given options, so maybe these options are not very correct, but among the given options, you have to look for the lipid soluble vitamin. In this case, it is vitamin A. As per the student recall, sir, vitamin A was the only lipid soluble vitamin in the option. So in this case, in cystic fibrosis, vitamin A deficiency will be there. Other options can be D, E, K, any lipid soluble vitamin. If it is mentioned in the option, it will be decreased in amount, because in cystic fibrosis, the fat absorption is poor, and therefore lipid soluble vitamin absorption will be decreased. एक option इसमें ascorbic acid भी था, ठीक है, तो ascorbic acid लिख देते हैं, लेकिन ascorbic acid, please remember, is water soluble, right? तो उसका pancreatic secretion से कोई लेना देना नहीं है. Pancreatic secretion will affect only the absorption of the lipid soluble vitamin. All right, only the lipid soluble vitamin will be affected when the pancreatic secretion is decreased. Why they are getting absorbed with the lipids? Lipid is not getting absorbed, so lipid soluble vitamins also cannot get absorbed. ठीक है, काट दिया thiamine, काट दिया रहमान, अरुण राणा, काट दिया thiamine, काट के vitamin C लिख दिया, ascorbic acid लिख दिया, ठीक है, उसको काट के लिख दिया ascorbic acid. But the answer remains the same, that you have to identify the lipid soluble vitamins. They will not get absorbed successfully in the cystic fibrosis. ठीक है, okay. Then we had a question of talking about megaloblastic anemia with neurological signs and symptoms. कुछ बच्चों ने बोला सर tingling लिखा था, कुछ ने बोला नहीं लिखा था, कुछ ने बोला altered sensation था, कुछ ने बोला altered vibration sensation था, कुछ ने बोला recurrent fall था. तो ऐसे करके कुछ neurological features दिए हुए थे. So please remember, whenever the anemia is mentioned, along with neurological signs and symptoms, which are actually a part of the condition called subacute combined degeneration of the cord, written as SACD or SCD, then we are talking about the B12 deficiency. ये आपने याद रखना है, गांठ बांध के रख लीजिए, that if there is anemia with neurological features which resemble the upper motor neuron lesion, then we are talking about the subacute combined degeneration of the cord, which is related to the vitamin B12 deficiency. ठीक है, vitamin B12 deficiency के कारण होता है. Megaloblastic anemia is seen in both B9 and B12 deficiency. लेकिन B12 में हमें न्यूरोलॉजिकल डेफिसिट मिलता है. We had done this when we were doing a rapid revision. There also we had done the difference between B9 and B12. हमने बोला that megaloblastic anemia, vegetarian patient was there in the question. Very good. तो ये तो और अच्छी बात है. अगर लिखा है क्वेश्चन में vegetarian diet, then you know that B12 is coming only from food of animal origin. Then it further supports your identification of B12 deficiency, right? So vegetarian diet will have very low amount of B12. B12 is only coming from the food of animal origin because it is generated by the bacteria only. So it will not be present in the vegetarian diet. And along with that, the neurological signs and symptoms further supports your identification of the B12 deficiency. So megaloblastic anemia and increased homocysteine. Very good, very good. Vibrance, vibration and altered sensoriums. था क्वेश्चन में मैंने बोला ना भाई, altered sensation and vibration sense. Resembling the upper motor neuron lesion, human lesion को resemble करता है SACD. ठीक है. So megaloblastic anemia and increased homocysteine, this will be seen in both B9 and B12 deficiency. ठीक है, ये हमने पहले बोला था. But अगर only the SACD and increased methyl malonic acid sometimes comes in the urine, we get methyl malonic aciduria. ये दोनों only B12 deficiency. So this is how you're going to distinguish between the B9 and B12. ये हमने पहले भी discuss किया था. In this case, because of these features which I mentioned, we are looking at the B12 deficiency. ठीक है. इसके अलावा we had a question on the anion gap. Anion gap वाला question में इधर ले नहीं रहा हूँ, medicine में cover हो जाएगा. And some question about the high anion gap metabolic acidosis. So those are covered in medicine. I'm not going there. There were a lot of overlap questions from pediatrics. So we have those questions, but we don't have the full statement and the options. So I'm not taking them here. But अगर आपके पास कुछ और question है जो हमने यहाँ पे नहीं डाला है, तो please let me know. Please let me know that we can include for our discussion. कुछ रह गया जो मैंने लिखा था और discuss नहीं किया आपसे. Okay, these are the points which are written for discussion. That is all that I have from your side at this moment. We are further compiling the details as sent by you in our different groups and chats. And we hope to come back to you tomorrow in the app where we will do the complete recall for biochemistry. And thank you for joining. And I know biochemistry was a little bit tricky today, but thankfully it was not from new topics. The topics were same. So I hope most of you have been able to do the biochemistry section properly. It was a little bit hard, but those who have handled it properly, we should be happy that they have done well. And as I can see from your responses, that most of you have done the answers well. Okay, so that's all from my side. I will be logging on now. Logging off now. Thank you very much, and best of luck for your result. Take care. Bye bye.
Hello everyone. So dear friends, now relaxed. कैसा लग रहा है अभी? So I know that paper was on little bit on the difficult side, but I think anatomy was not difficult, right? So I'm going to discuss certain questions with you guys, which I could get the recall from the students And mostly this session is to discuss with you guys for the language of the question, and also more questions from your side. If I can get the recall, it will be helpful, and then I will make the final. Okay. Can start, बच्चे? So this GIF was there. This image was there. This GIF was there. Pointing index. Okay, so this question was there, beta car test. Straightforward answer will be ulnar nerve, right? So straightforward question will be ulnar nerve. Car test was there, okay. And this question was there, the patient with the finger drop, like the history was given. Okay, tell beta, this question was there when the history was given with the finger drop without inability to extend the wrist drop. Means there was no wrist drop, and there was mentioning that there was a surgery for neck of radius or injury to neck of radius area, because we have the posterior interosseous nerve which is very close to the neck of radius. If there is a injury to the neck of the radius, this nerve will be gone. And I told you in the class that if finger drop only comes, आंख बंद करके posterior interosseous nerve लगाना है आंसर. ये क्वेश्चन था बेटा. This question language and it is okay. Can you guys please confirm? Now, was there any question of such language was there? The nerve supplying the little finger and half of the ring finger. Was there any such question? Rather, we had this pointing index. And hip flexion, knee flexion image. What was the question, beta? Image was hip flexion and knee flexion. अच्छा, इसमें इमेज थी, ये वाला एरिया दिया हुआ था इमेज बेस्ड. अल्नर नर्व आंसर है. हिप फ्लेक्शन और नी फ्लेक्शन में क्या है बेटा? पॉइंटिंग इंडेक्स में तो नी मीडियन नर्व आंसर है बेटा. हिप फ्लेक्शन नी फ्लेक्शन में क्या क्वेश्चन था? और ये क्वेश्चन आई कुड गेट द रिकॉल. द पेशेंट इज हैविंग द रोड ट्रैफिक एक्सीडेंट, है ना, एंड ही इज हैविंग ए डिफिकल्टी इन डोर्सिफ्लेक्शन एंड इवर्शन ऑफ द फुट. दैट मीन्स व्हाट? डोर्सिफ्लेक्शन नहीं हो पा रहा, द फुट ड्रॉप है. एंड आई टोल्ड यू नेक ऑफ द फिब्युला इसमें इंजर्ड है. और नर्व कौन सी इन्वॉल्व है? कॉमन पेरोनियल नर्व एट द नेक ऑफ द फिब्युला. ये क्वेश्चन था बेटा. अरुण राणा, केतन बुआ, दिस क्वेश्चन वाज देयर. ये था. तो अभी तक ये जो 3-4 हमने रिकॉल किए ये सारे हैं, राइट? और एक ऐसा क्वेश्चन भी था कि अ पेशेंट प्रेजेंट विद द लॉस ऑफ पिच इन वॉइस. पिच यानी जो टेंशन है उस पर वर्क कर रहा है. क्रिकोथायरॉइड इज द वन विच वर्क्स देयर. It increases the tension. If the tension is lost, then it should be external laryngeal nerve. It should be external laryngeal nerve because the loss of the pitch, cricothyroid muscle, which is a tensor, cricothyroid, which increases the tension. ठीक है. So अभी इसके अलावा आपने एक क्वेश्चन और you guys have told that pointing index was there and answer is median nerve and hip flexion, knee flexion image was there. The question was asking the muscle doing this, hip flexion and knee flexion. And this question, एक squamous suture, some students are telling this suture was marked. ये suture ऐसे mark किया हुआ था, like this, है ना? What was the question here? What was the question? Were they asking like type of joint? Type of joint they were asking? Like we have suture, we have syndesmosis, like these were the choices or what? Name पूछा था. Okay, what is the type? Which suture it is? And squamous suture was the answer? Arun Rana, squamous suture was the option and the answer? Squamous था option में. सभी स्टूडेंट्स कैन यू प्लीज टेल कि क्या क्वेश्चन था और क्या उसमें चॉइस थे. कैन यू प्लीज टेल बेटा. टायर्ड हो गए सुबह से, आज आप लगे हुए राइट. तो काफी सेचुरेशन आ गया इस टाइम तक आते आते, है ना. अब क्वेश्चंस कितने रिकॉल हो रहे हैं. बट चलो कोई बात नहीं, अभी आप रिलैक्स हो एंड आई रियली होप कि आपका, आई प्रे कि आपका रिजल्ट बहुत अच्छा आएगा और अच्छे मार्क्स के साथ पास होंगे. पास तो होंगे ही, अच्छे मार्क्स के साथ पास होंगे. ओके तो इस वाले में क्या बोलते हैं, जो ये चॉइस ऑफ सूचर आया था, इसमें स्क्वामस सूचर एंड अदर सूचर्स के नेम्स थे एंड स्क्वामस वाज द आंसर. वाज दिस टाइप ऑफ क्वेश्चन? ओके, डेंटेट कम अबाउट द सूचर, स्क्वामस इज आंसर. ओके, आई गॉट द आइडिया कि डेंटेट भी एक था और कम्युनिटी भी था. ओके, पॉइंट वाज एक्स वाज ये. ओके, ये तो हो गया, समझ आ गया. और अभी ये जो क्वेश्चन आप बता रहे हो बेटा, हिप फ्लेक्शन एंड नी फ्लेक्शन कब नहीं होगी, कौन सी मूवमेंट नहीं होगी इन दोनों में से? क्वेश्चन की लैंग्वेज क्या थी? डू यू, कैन यू गाइस प्लीज हेल्प? कि मसल की इंजरी बताई थी, नर्व दिया हुआ था, क्या दिया हुआ था, किस केस में ये मूवमेंट नहीं होगी, क्या पूछा हुआ था? So these were the questions which I have got the recall, and I'm sharing with you guys. This is my Instagram, Telegram, and प्लीज आप इसमें जो है मेरे को क्वेश्चंस की जो लैंग्वेज है थोड़ा सा रिकॉल करने में हेल्प करो, और इसके अलावा भी अगर कुछ क्वेश्चंस हैं तो प्लीज सेंड मी हियर, देन आई विल यू नो आई विल मेक द फाइनल रिकॉल बेस्ड ऑन दैट. Okay, thyroid gland. ओके, फेवर ऑप्शन था कि हिप एंड नी फ्लेक्शन में. ओके, प्लीज रिकॉल द क्वेश्चंस हियर और इन आवर ग्रुप. ठीक है, वीडियो भी था एनेट का. कौन सा वीडियो था बच्चे? श्रेया, कल्याण. एक तो आपका वो था जो कार टेस्ट का जीआईएफ था, है ना? कार टेस्ट पे था एक पामर इंटोसे मसल के लिए विच वी डू, राइट? आंसर फेवर था. ओके, तो हमारा जो व्हाट्सएप ग्रुप है वहां पे, या फिर ये जो टेलीग्राम है या इंस्टाग्राम है, कहीं पे भी आप मेरे को इमेजेस एंड लैंग्वेज ऑफ द क्वेश्चन शेयर कर दो, एंड बाकी का रिकॉल प्रॉपर फिर उनको इंक्लूड करके एक फाइनल रिकॉल बना देंगे. अभी तक के क्वेश्चंस तो यही तक के थे, ठीक है? एंड ऑल द वेरी बेस्ट. इंस्टाग्राम है, कहीं पे भी आप मेरे को इमेजेस एंड लैंग्वेज ऑफ द क्वेश्चन शेयर कर दो, एंड बाकी का रिकॉल प्रॉपर फिर तो इंक्लूड करके एक फाइनल रिकॉल बना देंगे. अभी तक के क्वेश्चंस तो यही तक थे, ठीक है? एंड ऑल द वेरी बेस्ट. टेक केयर गाइस, गॉड ब्लेस यू.
Hello students, I hope we are live now. Just 1 minute, I will take off yours. Yeah, इसके बाद ड्रॉप हुआ था, हिस्ट्री भी थी. चलिए, so good evening everyone. I could not get, in spite of asking many students ki which all questions were there from the subject of pediatrics, but what I got was what I could collect in this short time. There was something question related to the features of refeeding syndrome. Did they ask you all features or all except? This exactly I do not know, but there was a question of the refeeding syndrome, and in the refeeding syndrome there is hypokalemia, hypomagnesemia, hypophosphatemia, and thiamine deficiency. Right? Will anybody help me to know was this question or not, and what actually they asked? All except it was. I hope this was a question. Okay. Nobody is replying. I hope was it a question or not. Then there was basically a question vitamin deficient in cystic fibrosis. Cystic fibrosis we mainly say is the fat malabsorption, and if there is fat malabsorption, there has to be deficiency of vitamin A, D, E, K. Right? Thank you, Dr. Shreya. So this was a question of refeeding syndrome, and there was definitely a question here, vitamin deficient in the cystic fibrosis. So two choices I could get from the students, vitamin A and vitamin C. And in cystic fibrosis, there is biliary cirrhosis, exocrine pancreatic insufficiency. So definitely there is fat malabsorption, right? So if I put here vitamin C, so according to this, the answer should be vitamin A, right? Right. Some students are telling me, sir, cystic fibrosis pe in total 3 questions were there. Folic acid भी option था, so I put here good, very good. I just put here also folic acid. Right. Any more? If anybody can recall, any other question was there? All features, hypophosphatemia, hypokalemia, hypomagnesemia था, thiamine deficiency नहीं था. So what is the question except it was? Ketan, I think it was a question then all except. So here we say this particularly, this was a question. Then there was something related to question recall. I know very well it was a really tough paper for you all people. I can understand you all think mind भी tired है, mind भी anxious है. I can very well understand. हम just recall अभी कर भी नहीं रहे हैं, हम just ये discuss कर रहे हैं कि थोड़े से topics पता चलें, so that your juniors who are preparing for next year, they should also know which topics are there. That's the only point. There was a question something mid upper arm circumference 11.3 and weight for height, which was particularly given less than -3. Biotin था उसमें. So I make it a correction here. I make this as biotin. Done. डॉक्टर श्रेया सिस्टिक फाइब्रोसिस पे कम से कम 2 क्वेश्चन तो थे. Yes, it was 11.5. I can understand you people maybe 1 to 2 days में will come to know of all the other things. तब हम we can compile them. If it was a question, biotin I have added, still the answer is vitamin A will go in favor of that. So mid upper arm circumference 11.5, weight for height less than -3 standard deviation. If this was the question, then the answer is severe acute malnutrition. Complicated and uncomplicated. तो उसको भी हम चेंज कर लेते हैं फिर यहाँ पर, right? इसको भी हम चेंज कर लेते हैं. We make it one choice. We make is complicated SAM. Complicated SAM. And another choice we make it as the uncomplicated SAM. Uncomplicated SAM. Complicated SAM में कुछ और features must have been given. Some danger signs थे. If they had given regarding danger signs, appetite is very low, edema is there. If there were not such questions being given, Ketan, these choices you are saying, this is particularly for which question? You are saying particularly for the question number 1. Refeeding नहीं कर पा रहा है ऐसा कुछ था. Oh, okay. Refeeding syndrome में तो these 4 features are there. Hypokalemia, hypomagnesemia, hypophosphatemia, thiamine deficiency. We teach in the FMG regular best students this question. And this vitamin deficiency, in cystic fibrosis is fat malabsorption. And here unless and until some other language is there, only if it is written this much, then you should go for uncomplicated SAM. No, sir, the question was what all are the seen in the feeding syndrome? Each option had three choices. Okay. Now I understood. Each option had three choices. Understood. So it should have been hypokalemia, hypomagnesemia, hypophosphatemia. Just like this, each option had three choices. Understood. We will frame the question like this only, right? And in them, one of the choices was hypocalcemia also. Good, Swati. Good. Thanks for helping. Right? Good. Then I think a question was there on a video of severe dehydration where this skin turgor was particularly shown, right? And it was something very slow recoil. Okay, Omron, I understood. We'll get the question definitely. We're just trying to understand what all came today. Actually, we'll be all collecting, making, and we'll be recording in a different scenario. Skin turgor, it was very slow recoil. Was there a video? Yes. Skin turgor slow. So it was showing severe dehydration. They just asked you. The same question was not framing in favor of uncomplicated SAM. Dekho, if you Swati can tell me what other things they have asked. Was appetite given poor? Was the child lethargic? Was the child not accepting feeds? While the child had severe edema, child had anemia. If something danger signs is there, we'll go for complicated SAM. I do not know, just on this basis I am saying. Biotin we have added. Ali, we have added biotin, but try to understand in cystic fibrosis, what we are saying is deficiency of fat malabsorption. So there will be deficiency of ADEK. So dehydration पे एक तो वीडियो वाला क्वेश्चन था, you are saying, right? No treatment पूछा था, मतलब they ask you the severe dehydration and they ask you the treatment, क्योंकि एक question according to the students on severe dehydration was there and they asked you how much fluid to be given. Okay, the child is also drinking poorly, right? So if this was the scenario, we are going to follow the plan C, and in the plan C, the first you give is ringer lactate. If not available, you can give is normal saline. Right? If it is a diarrhea, always remember the first is ringer lactate. If vomiting is causing, then the first is normal saline. If diarrhea is causing severe dehydration, first is ringer lactate. Ringer lactate is an option, that's true. And there was something, a question, lethargic child can't drink. You are asked to calculate how much fluid is to be given. Again, a question based on the severe dehydration. A question based on the severe dehydration. So we are following is 100 ml per kg fluid, and that is divided into initially 30 ml per kg followed by 70 ml per kg. Agar severe dehydration and vomiting was there, diarrhea if it is given, ringer lactate is the answer. If both are given in the choice, ringer lactate and normal saline also. And if vomiting is given, you should preferably choose the answer normal saline. Okay, Swati and Ketan. Then there was a long question related to a seizure. The child had also low academic performance. Was there something a question related to this? Zinc dose was asked where in we had in the end. The zinc dose they asked in diarrhea or normal zinc dose they asked? Dose of zinc. Actually, here the symbol is coming, so I'm not. Dose of zinc in 10 to 19 years they are asking. But somebody is having a zinc deficiency. The question was like this. The dose of the zinc, if somebody is having a zinc deficiency, the dose is 0.5 to 1 milligram per kg per day. That is the dose. Omron Ketan was in choice. Then, according to some students, some question a child having a seizure and a low academic performance. If that is there, this is pointing towards the absent seizure. Was this a question? Will anybody help me? No. Dose of zinc in less than 6 months. Zinc question had very different language. देखो, if you ask me the dose of zinc in less than 6 months and particularly 2 to 6 months, if the child has diarrhea, we are giving is 10 milligram per day for 10 to 14 days. 10 to 14 days. No, sir, no absent seizure, nothing. Was there any question related to seizure in children? They asked something to manage acutely or something. Any question of seizure in children? One I have heard, although it is a bouncer question, a very difficult question. They asked about SCN1A gene, sodium channel gene. Sodium channel gene. देखो, less than 6 months, the dose is 10 milligram, and if it is more than 6 months, the dose is 20 milligram per day for 10 to 14 days. SCN1 gene question was there, na? This is, we don't teach actually, I only teach in NEET PG, and the answer to this is Dravet syndrome. That is, you also call it as severe myoclonic epilepsy of infancy. I do agree this is not a normal question. I do teach in PG, but I don't teach here. So one seizure question was there, right? So, matlab, I just remove here from this. Low academic performance does not carry, right? So although we are true, there was a question of 14 by a seizure. A 14-year-old boy has seizure for. So you are saying is I should write here 14-year-old boy have seizure for 35 minutes and give buccal midazolam 10 mg, but still have seizure. Now, actually, if somebody is having a seizure for more than 30 minutes, right? So that basically goes in status epilepticus. Clear? And in the status epilepticus, the first phase is, matlab we say 5 to 20 minutes, you manage with benzodiazepines. And from 20 to 40 minutes, we manage with non-benzodiazepines. We manage with the non-benzodiazepines. Right? So here you can give sodium valproate, you can give fosphenytoin, and you can give lavsitam. Clear? First phase is 5 to 20 minutes. You can give midazolam, lorazepam, diazepam, and that can be repeated 2 times. 20 to 40 minutes is the second therapy phase, and you basically manage with non-benzodiazepines. Okay, Dr. Mohammed Ketan. Option was lavsitam and also phenytoin. Anything else was there mentioned? Which type of seizure? Nothing. Tonic, clonic, generalized tonic, clonic. Something was mentioned? Nothing. Not mentioned. Just seizure it was mentioned. And phenytoin 15 milligram per kg, you are saying lavsitam 600 milligram. These are the choices. Exactly. Generalized tonic clonic seizure mentioned. Generalized tonic clonic seizure was mentioned. Drugs given, what next to do? I think we can give non-benzodiazepines here. Fosphenytoin, lavsitam, sodium valproate. But phenytoin we give normally 20 milligram per kg, and lavsitam it was given standard dose of 600 milligram, or the child weight was given also. Something related to child weight which was given. No mention. Okay. Then we say mid-diastolic murmur. Was there a question related in which of the conditions mid-diastolic murmur is there or something? Some option with propofol. Propofol will not come. Propofol come after 40 minutes. Increasing the dose of lorazepam is also not correct. You need to give a non-benzodiazepines, that is correct. Now we have to choose between phenytoin and lavsitam. Paper I think really was a tough one paper I can think of. Although some small topics were repeated. Mid-diastolic murmur, if it was the question, so this is heard in the mitral stenosis. This is heard in the tricuspid stenosis. Anything more was given anywhere? This was the simple choices in this question. If can somebody help me in framing the question, right? Just like Dr. Mohammad Farman helped in the previous question. If we can help, what was exactly the question? mitral stenosis with afibrillation. But this was given and they asked which murmur will be present. Jai Shankar. Okay, we'll have to come with the exact question. We'll be collecting them. It was already a simple question. Bleeding gums, poor wound healing, pain in both lower limbs, perifollicular hemorrhages, spongy swollen gums. I hope it's an option. It was like this. Okay. Okay, Omran, I will go through that question. You have said here it was mitral stenosis with atrial fibrillation. Okay, we'll come to that question. I hope this was a simple question which everybody must have marked correct. That is vitamin C deficiency. Everybody get you must mark as correct, vitamin C deficiency. Pneumatocoel ketan is normally seen in Staph aureus. And I don't know what exactly it was the question. Might be more of a radiological question. Was there a question screening for aneuploidy? Because Down syndrome, Patau syndrome, Edwards syndrome, all are aneuploid. Aneuploid basically means abnormal number of chromosome, not exact multiple of, not exact multiple of haploid number. Not exact multiple of the haploid number. Okay, vitamin C deficiency was not there. Very true. They asked the deficiency of the enzyme. So that must be particularly hydroxylases, because vitamin C causes hydroxylation of what? Lysine, right, which is help in the collagen synthesis. So they asked about the enzyme deficiency, so I am writing here. Enzyme deficiency. One is collagenase, one is elastase. Right? Any more choices you would like to add here? Proline. देखो vitamin C helps in hydroxylation of proline and lysine. So hydroxylation of, that means all of the questions this time they were as such integrated questions. Hydroxylation of proline and lysine. If it was particularly given, the answer has to be this one only. Collagenase and elastase was as one option. Okay, change it to. Can you help me in recollecting what were the other options? Thank you. People are really helpful to me, right? I'm telling you, I helped a lot in the questions. Screening for aneuploidy, abnormal number of chromosomes, not exact multiple of haploid number. That is aneuploidy. All trisomies are aneuploidy. If you are doing screening particularly, screening, we are saying, not confirmation. Screening in the first trimester, that is nuchal translucency thickness. And if the confirmation is there, then the answer will change to chorionic villi sampling. If it was asked confirmation, then it is chorionic villi sampling. In the second trimester, was this the question of screening or confirmation? If anybody can help me. Confirmation, amniocentesis. Then we say 5-year-old child, progressive abdominal distension for last 2 months. On examination, large form non-tender abdominal mass is there. MRI shows a mass arising from the kidney. It's more OBG question. Okay, we'll remove Amron from here. 16 weeks, we'll go for that particularly. We'll remove for our final one. This is more of an OBG question. Done. Right? Was such a question given? 5-year-old child, progressive abdominal distension. On examination, large form non-tender abdominal mass. MRI shows a mass arising from the kidney, which was saying something not crossing midline. Was this question given? And if this is such a scenario, most likely it is the Wilms tumors. Wilms tumors. And surprisingly, nobody has told me any particularly questions on neonatology. NIPD was an option in the before question in this one. Okay, NIPD. Okay, this is more of a than OBG question only, very true. Not even a single student told me no neonatology question, no neonatal resuscitation, Apgar score, hyaline membrane disease, meconium aspiration, transient tachypnea of newborn, neonatal jaundice. Okay, Ketan, if this was some language like this, this was an option of the Wilms tumor, not crossing a midline, arising from the kidney. So it's most likely the Wilms tumor only. सर आया नहीं एग्जाम में. Which question? This 10th question एग्जाम में नहीं आया. Meconium पे क्वेश्चन था. Anybody can recall what was the question on meconium? मतलब it was related to OBG or related to child? Can anybody recall? Anybody recall? Child has not passed the meconium. Was that question? Any question on neonatal reflexes? On pneumonia, congenital heart disease, ASD, VSD, PDA, TGA, TOF. Any question on nephrotic syndrome? No? Okay. Then basically thanks all for joining. I will basically try, if you can send me those questions, you can please send me here on the Telegram group, or you can message me on the Insta. It will be really helpful, so that we will be compiling in 1 to 2 days all of the sources for what we get the collections, and with the exact choices we'll be giving you the answers. Right? I pray to God till then all you get the result what you are hoping for. Right? God bless you all. Stay blessed. That is more than which is important. So can I take leave now? Meconium more than था हुआ था मतलब exactly meconium भी नहीं हुआ था बच्चे का gold standard diagnosis, that was standard one, anorectal manometry. If that was particularly the question, child has meconium, right, and meconium is more than 48 hours, then you should always choose the answer anorectal manometry, because it is not only diagnostic but it can also be therapeutic. पीडिया का लीवर एंड लंग इन नॉर्मल सेलाइन. एनोरेक्टल मैनोमेट्री था तो एनोरेक्टल मैनोमेट्री बिकॉज इट इज नॉट ओनली डायग्नोस्टिक, it is not only diagnostic but can also be therapeutic. Any more questions? Surprisingly, no question on congenital heart diseases. नहीं, बायोप्सी नहीं आएगा, एनोरेक्टल मैनोमेट्री ऑप्शन में आए. एनोरेक्टल, सॉरी, more than 48 hours, we should always choose. I'm sorry here, my answer here. Your answer should be gastrographin enema. I'm sorry. Your answer should be gastrographin enema. More than anorectal manometry. I was thinking something else. Really sorry. Your answer is gastrographin enema. It is not only diagnostic, but it can also be therapeutic. Was there in the change? Was this given gastrographin enema? अगर गैस्ट्रोग्राफिल अनीमा नहीं है तब एनोरेक्टल मैनोमेट्री चॉइस. पोस्टमार्टम चेंज तो केतन particularly they will, you go in that thing, forensic वालों की से. No question on congenital heart disease, surprisingly. बेरियम एनीमा नहीं होना चाहिए, गैस्ट्रोग्राफिन एनीमा. बेरियम एनीमा इज नॉट द राइट आंसर. राइट हियर ऑप्शन में बेरियम एनीमा भी था. Was gastrographin एनीमा गिवन? अगर गैस्ट्रोग्राफिन एनीमा नहीं था तो आंसर एनोरेक्टल मैनोमेट्री आएगा. डन. सही हो. थोड़ा बहुत एग्जैक्टली कुछ आइडिया लगा है कि कौन से क्वेश्चंस थे. Right, and no questions on intrauterine infection, toxoplasma, rubella, cytomegalo, hydrocephalus, congenital syphilis, varicella, short stature का क्वेश्चन, कोई माइलस्टोन हो, कोई अपर सेगमेंट लोअर सेगमेंट रेशियो का क्वेश्चन हो. रेक्टल बायोप्सी भी नहीं बनेगा, although I will write here the choice. CMV का क्वेश्चन था, कोई बताएगा साइटोमेगेलो वायरस का क्या क्वेश्चन था? साइटोमेगेलो वायरस का कोई क्वेश्चन बता पाएगा? शॉर्ट्स टीचर का कोई क्वेश्चन बताएगा? व्हाट वाज द क्वेश्चन ऑफ शॉर्ट्स टीचर? One growth chart was given. What they ask in the growth chart? ग्रोथ चार्ट में क्या पूछा था? डायग्नोसिस पूछा था, कॉन्स्टिट्यूशनल इमेज बेस्ड था, सीएमवी का पैथोमिक्स था, 50 स्टैंडर्ड डेविएशन शोइंग ग्राफ में वेट हाइट का, तो 50 स्टैंडर्ड से बिलो था, ज़्यादा था? व्हाट वर द चॉइसेस विश्वजीत, इफ यू कैन टेल मी? सीएमवी का क्वेश्चन तो इमेज बेस्ड था, सीएमवी का पैथोमिक्स था, मतलब नॉट रिलेटेड टू कॉन्जेनाइटल साइटोमेगेलो वायरस ना, तो इस क्वेश्चन को भी हटा देते हैं फिर। इसका मतलब दिस वाज पैथोलॉजी क्वेश्चन। सर एग्जैक्टली 50 थी दोनों में, और ऑप्शन में क्या था? दो ग्राफ दिए थे इमेज में, ठीक है, तो ऑप्शन में पूछा क्या था? नॉर्मल स्टेचर था, शॉर्ट था क्वेश्चन में, वन ऑप्शन नॉर्मल स्टेचर था, शॉर्ट था क्वेश्चन में। पैथोलॉजी क्वेश्चन यू आर सेइंग दिस। ग्रोथ चार्ट वाला क्वेश्चन देखना पड़ेगा, व्हाट एग्जैक्टली दे आस्क्ड, इफ यू कैन गिव मी द मतलब चॉइसेस। एक चॉइस तो आप कह रहे हैं कि ये था नॉर्मल स्टेचर, यही था, और कोई दिया हुआ था? कॉन्स्टिट्यूशनल डिले, फैमिलियल शॉर्ट स्टेचर, कुछ ऐसा दिया था? नहीं। चलिए, और ज़्यादा टाइम आपका ना लेते हुए, थैंक यू ऑल फॉर ज्वाइनिंग, थैंक यू सो मच, यू particularly came, right? That's so much. Right? Growth chart वाला question I will try to find out, कहीं ना कहीं तो मिल ही जाएगा. Then will all the questions compiled will be here again to discuss. I have given you the links. अगर please if you get any questions do message me directly, or you can share in the telegram group. नहीं तो हमारे जो डैम्स का व्हाट्सएप ग्रुप है उस पर भी प्लीज आप शेयर कर दीजिए, so that we come to you with the final answers. Done. Stay blessed. Lots of best wishes to all of you. Lots and lots of best wishes. Right? Hand foot mouth disease, actually we don't think that is covered in the medicine part, or that is covered in the microbiology part, इसलिए केतन मैंने डिस्कस नहीं किया. Right? So with this I take leave. Thank you all. Waiting for